Welcome to the Josh Button Podcast, where we discuss health, wellness, and outliers from society. Welcome back to the Josh Button Podcast. Today I am absolutely stoked about my guest, Mr. Ryan Aleckszander. You have been quite the influence on me. You've had so much pertinent information that I could relate to that I needed right when I needed it. I somehow found it on your channel or on your Q&As. You are an author of a couple books that I cannot recommend enough to enough people. I would like to force it down some people's throats, to be honest. But as you probably know, that doesn't work so well. Thank you for joining me.
Thank you so much for having me, Josh. I'm stoked.
Awesome, man. Please introduce yourself. I know you can do a much better job than I can. Tell us your background, your story, how you came to Dr. Wallach, and to actually authoring these awesome books.
Well, my name is Ryan. I was born with health problems. I was born with dislocated hips and childhood arthritis, twitches, cramps, all kinds of pain. I grew up in pain, basically. And I didn't really think there was a way out of it. I had given up looking for a way out of it, basically. And I was pretty sure I was just going to be in a wheelchair by the time I was 50. That's what they told me anyways. But somebody gave me this magic mineral formula, and it worked. It worked extraordinarily well, extraordinarily quickly. In less than a week, all my lifelong pains were gone. My insomnia was gone. Insomnia is part of the same mineral deficiency syndrome there as the arthritis and the muscle problems. And it was just ridiculously quick. It's one of the fastest results that you will ever see in this business. So it was the best case scenario. And at that point, I had to abruptly change course in life and say, I've got to do this. I've got to spread this, got to sell this, whatever it is, whatever this business is, I've got to do it. I didn't really understand what it entailed at that point. But we began just speaking the message. Random people we'd meet in the grocery store and doing little events at farmers markets and churches and stuff like that. And fortunately, the group that brought me in was always very close to Dr. Wallach and pharmacist Ben Fuchs and some others. So I got to really immediately start working with them and hitching on to these events that already existed and stuff like that. So it wasn't like I had to start from scratch, but I was kind of groomed in a good way to become a speaker in this pretty early on. You know, they told me right near the beginning, Ryan, you're going to give the message one day just like Dr. Wallach does. And I'm like, what are you talking about? I don't seem like I'm prepared or qualified for that, but okay. And the truth is, you don't actually need to be a doctor or a PhD or anything to understand this. The guy who fixed me, I would say, the guy who gave me the information, who gave me the product, he was a bus driver, right? You know, you don't have to be anything special to understand some basics and to help people out, get them started. It really usually is that easy, but it can get a lot more complicated, which I have learned. So I have taken it upon myself to learn the ins and outs far beyond our general message. You know, people put a lot of faith in us. People kind of expect us to be able to fix anything. And it's a lot of pressure, but it turns out that there is an answer for almost everything if you dig deep enough. And sometimes it's a lot more than our basic message of just take the 90 essential nutrients and just get off of processed foods. Sometimes there is more to it, but I've gotten quite good at figuring it out for a lot of people. So here we are now, and this is more than full-time. It's double full-time, putting out the information on social media, Instagram, Facebook, and TikTok, and YouTube, and podcasts, and coming on other podcasts like yours, spreading the message one post at a time, one podcast at a time, one person at a time, hopefully adding up to the difference that we need to see in this world. We want to conquer chronic disease. That's the goal here. It's a very lofty goal, but I think it's 100% possible. And in that process, we should make people like me irrelevant, redundant. You shouldn't need people like me to do this. And I think we're making some traction on this. Josh, you're one of many who understand at least the basics, which is absolutely enough to fix most problems. And if this is carried on for another 1, 2, 3 generations, we should be able to see the elimination of most or all chronic disease.
Now, with that said, right away, I'm going into thoughts of one of our biggest adversaries, one of the potential adversaries to actually health, and that is the health industry. And what do we need to see to have drastic and radical change in allopathic remedies and to the methods that most people are actually pursuing at a very high expense and also not getting the results that they're actually looking for, that they're in search for?
Well, all parasitic organisms have a problem where if they're too aggressive, they kill their host.
Right.
And I do think that this has happened already in the medical industry, where they've taken things too far and they've gone way beyond what they are good at. And it's worth saying at the outset that mainstream medicine is good and necessary for some things. We absolutely need trauma care.
Mm-hmm.
If you fall off your motorcycle or get shot by a bullet or something like that, we need emergency rooms for that. We need life-saving drugs for that can stop you from bleeding out and that type of stuff. Modern surgical techniques and all this stuff will save your life in many of these cases. Don't come to me if you get shot. Go to the hospital, right? And they can also be very good at some severe infection cases. Sometimes. They've taken this too far, but sometimes they can be very good. They can save your life in an infectious emergency, which I have experienced myself, and I'm 100% certain that antibiotics saved my life.
Likewise.
So that is a branch of medicine that is necessary and will remain necessary. The problem is the medical industry has been able, through its monopolization of healthcare in general, it has been able to classify practically everything as a disease. And as I explain in my book, Fake Diseases, and you can find all my books, by the way, on my website, notusbooks.org. In Fake Diseases, I explain this, that the reason something is called a disease is so that it can be treated by medical doctors. They're the only ones that are allowed to treat things, with some exceptions. If maybe you could be a naturopath or an osteopath or something. But in general, you got to be a doctor to treat something. And insurance pays for treatment. This is key. Insurance pays for treatment. Insurance only pays for treatment if it's a disease. Therefore, now we have addiction is a disease, obesity is a disease, alcoholism is a disease, everything's a disease, so that it can be treated by mainstream medicine. The problem is drugs just don't work very well, or at all, for the vast majority of things that people actually go to the doctor for. You wouldn't believe how many people go for stress-related issues and chronic fatigue and stuff that there's no way a drug can possibly help you. And the problem is mainstream medicine never was trained in nutrition. They took out nutrition. Nutrition was never part of their thing. So most of these problems, if not all these chronic problems, are caused by nutritional problems. Nutritional deficiencies, processed foods, digestion problems, stuff that mainstream medicine has no business dealing with and never did. The best they've been able to come up with is some drugs that don't work. They just flat out don't work. And a lot of people understand this. There's a phrase that you'll hear often. It's that science advances one funeral at a time, and medicine's the same way, right? The old ideas die hard, and fortunately, many of these ideas are dying out. It has been 70 years, 50 years, 150 years for a lot of these ideas. Like cholesterol is bad, salt is bad. These types of things, or what you eat is irrelevant as long as you're eating the 4 food groups. These concepts are dying out because it has been 70 years or more or less. Those people who were brought up under the idea that Mediterranean diet is the way to go and all this stuff, they're dying. These ideas are fading out. And there is a new generation of doctors, medical doctors, who understand this. And we can see a lot of them on Instagram and TikTok and stuff. They're invariably younger people who have come up realizing that what their professors were taught is wrong. So this is dying out. The spectrum of what medicine does or should do is narrowing. And on the public side of things, a lot of people have lost faith in mainstream medicine. The only reason there's an alternative business industry is because people have been failed by mainstream medicine. I was failed by mainstream medicine, and pretty much everyone in this business was also failed. We're not here just because we're interested in health. We're here because we had health problems and medicine couldn't fix us. My doctor tried everything, all the drugs, and it didn't take very long for him to say, look, you're not responding to any drugs, so I don't know what to tell you. He was honest enough to say, well, that's it. You're at the end of the line here. There's nothing else for you. There's no surgery that's going to fix your chronic pain. It's just, it doesn't work that way. So you're on your own. And a lot of people are experiencing that. And that's why we have this industry, which is growing. It's been growing for decades. It's been growing since the 60s or before that. But now, especially after the pandemic, we're busy. I promise, we're busy. I'm busy. Everyone I know in this business is busy because by and large, people have completely lost faith in mainstream medicine.
So was the pandemic in itself a blessing in a weird roundabout way? I just watched your podcast with the undercover virologist, and it really triggered a lot of thought on that. I mean, could this actually have a silver lining that it will lead more people to terrain?
Since the very beginning of the pandemic, I was saying they overplayed their hand with this whole thing. And for listeners who don't know me, I was saying that this is a hoax from the very, very start. And we might as well go back to the beginning here. Okay. Yep. At the beginning of the pandemic, most people don't remember or they never saw it, but we were being shown videos of Chinese people falling dead in the streets. They were falling over while they were just standing there. They were falling over in stores. And if you look closely at these videos, you can see that they're actors. They're breaking their fall. They're looking around after, like they're laying there for a little while and then they're looking around after and stuff. I made a documentary, and now it's a series of documentaries about this, kind of just a compilation of clips that I save over the year. It's called Wag the Dog Theory. You can find it on wagthedogtheory.com or Rumble. There's 4 of them now, and I'll be doing a 5th one this year. But that whole thing started from these fake videos of Chinese people falling dead in the street. And you can see some of them get up afterwards and stuff, like, it's being done for the film. That was what was being sold to us as what's going to happen. A lot of people, again, they forget this. This is what was supposed to happen. We were supposed to fall dead in the streets. Nothing like that happened anywhere. Even Chinese people outside of China, this never happened. So even if it was actually, if these people were actually falling over and they were actually sick or they were actually dying, it was a problem that only existed in China. Never happened anywhere else. But this is what caused the world to shut down in an emergency state. So anyone who did see that should always have that in their mind, that no, this was fake from the start. There's no lab leak for actors falling over. It's not a lab leak. It was acting. It's fake. And we can get into lab leak and all that stuff later. But I'm just saying, from the very beginning, I was 100% convinced that it was a fake event. And I was hoping, most of us in the conspiracy type of world were hoping that it was going to be so obvious to so many people that they would completely lose faith in medicine, in government, and in media. That needed to happen because these organizations all work together. The government itself is not funded by Big Pharma, but the individual agencies are. The CDC is a vaccine company, essentially. It's nothing without pharmaceutical companies. CDC, the FDA, FTC, all this stuff is funded by Big Pharma, basically. And so is media. Media advertising revenue largely comes from Big Pharma. So they all work together, and they all need to go down, or at least we need to stop listening to them, all of them, in order to regain control of our health. And it did happen. So yeah, you're saying, was it a blessing and a curse? Yeah, it was a blessing. They overplayed their hand way too much, and it became so obvious for so many people that since the pandemic, people like me are busy dealing with all those people who tell us every single day, hey, I lost total faith in this. I can't believe I fell for this, all this stuff. I took the jab thing and now I regret it. But now I'm also learning that my rheumatoid arthritis or my diabetes or whatever, it all had nothing to do with a drug deficiency. Oh my gosh, I get it now. That allowed them to be exposed to all this other information, that it's not just COVID that was a scam. All of it's a scam, except for trauma care. All of it's a scam.
So how long has it been like this? Have you studied the history of it? I know you did a book review on the potential Spanish flu, a book that said it was technology increases or electricity in the home and different things that we could have had at the same exact time. Has the government always been in bed with Rockefeller medicine, with big pharma, with medical sick care, I guess is a better way to put that?
I don't think you need the full government involvement here because big pharma itself is just extremely powerful and always has been since the start. It definitely became more powerful with government involvement and with government approvals and stuff like that. Like prior to the FDA, there's no such thing as a government approved drug, right?
Mm.
You had to actually trust the drug company. And back then, I'm talking 1800s, no one did trust the drug companies anyway. So it was very hard for them to gain faith with the public. But when things became FDA approved, that did give people a lot of confidence that, oh, they must have looked into this. They must have done some serious trials, rigorous trials for years and stuff like that. And the truth is, most of them aren't. They do have to do trials, but most of them are not that rigorous. They don't last that long. They're cut off when people start dying and stuff like that. All kinds of scams since the start. But going back to the Spanish flu, yes, and polio, good example as well. These things killed so many people because the government was involved. Step back a second here. The book that you're talking about that blamed EMF is The Invisible Rainbow. And there's another book as well, The Contagion Myth by Thomas Cohen. And actually, it was renamed to The Truth About Contagion because Amazon took it down. They couldn't have the word myth in there. Truth About Contagion. Both of those authors do believe that it's EMF. I'm also in the EMF business, just by happenstance. I happen to have been selling anti-EMF devices for several years, almost as long as nutrition. And people asked me about this since the beginning of the pandemic because there was a counter meme out there, and still is, that, oh, this COVID thing is only happening because of 5G. That's what they were saying. Well, fake people falling down on the street is not caused by 5G. It's caused by acting, first of all. Second of all, 5G is not everywhere. 5G is still not in Canada. Even if you pay for 5G, you're being scammed. There's no 5G in Canada. I live way up north half the time, and there's no 5G there, right? So there's still cases. There were still cases. There was still something happening there. And we could talk about whether it was a poison or whether it was just a mind virus or whether it was just regular flu where people were going and being killed in hospitals from drugs and from ventilators. They were murdering people, basically. A combination of all those things, I think, are relevant. But the point is, it did not happen everywhere just because of 5G. That's not true. I never believed that. It could have something to do with it. EMF does impact our health, but you can't have a fake disease caused by EMF, basically. So those two books, they have a correlation that makes sense, that every time EMF was increased somehow, you know, a new cell phone network came in or a new power line system in America or wherever, radio, they're correlating this with different outbreaks. There's a very strong correlation there. And I don't doubt that for actually people getting sick, that is a correlative factor. But what really happened in 1918, as far as I can tell with the Spanish flu, is that it was not a flu at all. It was a heyday of mass injections of experimental vaccines. This was sponsored by the government. And the same thing was happening with polio. Excellent book on polio is called The Moth in the Iron Lung. Very, very good. Forrest Merity, I think, is the author, where he was talking about the history of DDT and pesticides and basically saying that the pesticides, the overuse of them, were causing the symptoms of paralysis, basically, is what it was. Short-term paralysis. That's what caused what we would call polio, the epidemic version of it, because there's a lot of things that can cause paralysis, basically, but this specific thing was caused by the DDT. But then they brought in poisonous injections, and it made it even worse. So this happened in 1918 as well. People were being shot up with multiple different experimental poisons and being given multiple early drugs. These are very primitive drugs here that are from a long history of poisonous drugs, right? Doctors have been using mercury or calomel, arsenic, and extremely toxic things they've been using forever. I don't know why they got this into their idea. They got this idea into their head 500 years ago that, yeah, we've got to poison people if they're sick, right? If we bleed them or we poison them, or we bleed them and we poison them. That's all they had, right? Cause them to vomit, right? Cause them to purge, right? Purgatives. It's all they had. That's all. So medicine always evolved from that, from using poisons. And especially in the early years, they were extremely problematic. And yeah, it was just a wild west of let's inject everybody with all this stuff. And I believe that's what caused the mass deaths in 1918 and in the polio, even though most of the people died from the actual paralysis before the vaccines. It was already on its way out before the vaccines came in, but then the government came in. And this is very famous too, where we know that the early polio vaccines were done on a trial basis on the public, first of all. Second of all, they did kill people. And this was admitted. It's not a secret. This is not a conspiracy. They did kill people and they pulled them off. And then they came up with some new ones that they gave the credit to, even though the credit should be given to the fact that they just weren't using the pesticides anymore. So yeah, those main epidemics were government sponsored. Everyone wouldn't have gotten, like some people would have gotten injected, but not everyone would have gotten injected if the government didn't come in and make it mandatory or strongly pressure people to do it.
So we're talking Tuskegee experiments, but on a broader scale and before that. And this is a repeating performance or a repeating exercise that they've done multiple times in different ways and manners.
Yeah, except that Tuskegee was done without consent, right? And without disclosure, whereas these other ones, the government just said, we are injecting you with a polio vaccine. It wasn't a secret, basically. But yeah, and they have done many other secret types of experiments and stuff, spraying stuff over certain cities and seeing what happens. And
so
lots of dodgy stuff, dodgy history.
Right. What are your thoughts on AIDS and Fauci and RFK's explanation for it and the medicine being the actual poison?
I'm 100% on that theory, yes. Since I released Fake Diseases, the first version of it was 2021, early 2021. And I updated it the following year. So it's been about 3 years, 4 years. In that time, I read every AIDS book that I could find. For it, against it, whatever. Got a whole shelf full of AIDS books. And it seems extremely clear that a little bit of a complicated subject here, okay? People should understand that AIDS is not one thing. Before there was, they, quote, discovered HIV, before there was any tests for it, it was already a spectrum of disorders. One of them, the first one, was called Kaposi sarcoma, which is a rare and kind of weird cancer. And then they also had some pneumonias, some pneumocystis pneumonia carni, I think is what it's called, PCP. Those are caused by drugs. Both of those are caused by drugs. The first 4 cases, AIDS was started from 4 cases of homosexuals who had the Kaposi sarcoma. We call it KS. I don't like abbreviations, but it's KS. Those homosexuals, it's not because they were gay. This is where a lot of the misconception comes in. They called it gay cancer first of all, right? Before it was AIDS, it was gay cancer in slang. It was Kaposi sarcoma. And it wasn't because they were gay that they were getting cancer. Being gay doesn't make you have cancer. Having sex with a man doesn't give you cancer. But what these men were doing when they were basically liberated in the 60s and 70s and stuff, where they were allowed to come out and be themselves, so to speak, what they did is they created a bunch of clubs, discos, parties, having the time of their life, doing tons of drugs. I can actually pull up a list here, give you a little bit of an idea of what types of drugs that they were using and in what kind of quantities. But they were basically acting as party animals. You know, they were in the closet, and now we don't have to be in the closet. We can just go out and have fun. And you know guys, right? Guys are rambunctious. We would hump everything if you let us. Well, you get a bunch of guys with that mentality together, and they're having hundreds or thousands or tens of thousands of partners because they're all just horny guys and they're all down. Let's do it. and they're having lots of fun in these discos. They're staying up all night. They're drinking. They're doing tons and tons of drugs. And this is not me making it up or being, I get like racist or something, gay racist. I don't know. It's not what it is. This is the record of these people themselves, especially the ones who came down with KS or with PCP or some of the other spectrums of diseases. And I'm digging for this list here. I'll get you this list. But after that, after the initial cases and stuff, and they came out with HIV and they started testing people for it, and they kept broadening the amount of diseases that could be called AIDS. So if you're HIV positive and you had one of like, I think it's 30 or more different diseases now. But by the time there was 1990s, there was like 30 different diseases that you could be called AIDS with if you were also HIV positive. If you're HIV negative and you didn't have one of those diseases, they didn't care. But there's this huge umbrella that allows them to call you an AIDS person, AIDS victim.
Is there fraud involved in the testing?
There was fraud from the very, very start. From the very, very start. We can talk about the original trial there of AZT. Let me get to that. Let me find this description here. Because I don't want to brush this off, right?
Right, no.
It's like 90% of AIDS people cases were drug addicts. Either homosexuals who overdid party drugs or actual just intravenous drug users. This is most of the cases. Then you've got hemophiliacs who already have a blood disorder. They have a disease already, right? And their immune system fails. Like hemophilia is a pretty deadly thing to begin with. And there is very little other cases beyond that. And when you take into account the fact that the tests are very unreliable and that me and other people believe that HIV has just nothing to do with anything. Plenty of healthy people have HIV or HIV positive. I shouldn't say have, because you don't have anything. This is not a real virus. We don't even believe that viruses are transmittable or anything. There's something that's created in the body when you're sick, even when you're not sick. I recently had somebody, we don't get too many people with HIV or HIV positive. We don't get too many of those people, but now and then we do. And I recently had a woman from Europe message me, I'm HIV positive. What do I do? What do I do? How do I get this thing out of me? And we do what we normally do. We give them a questionnaire so that we can see what's going on. And she's fine. She's fine. She has high blood pressure. And I think she had one other minor symptom. There's no reason for her to be on immune destroying drugs, which is what she was on. So I'm just telling her, like, it's your choice to take immune destroying drugs if you believe this whole thing, but you don't have a problem. You have high blood pressure. Like, this is not an emergency here, and this is something you can fix pretty easily.
So complete misdiagnosis.
Well, it's just a fake test.
Right.
It's a test that'll find whatever it's looking for.
Essentially a PCR from the 80s or 90s, whatever.
It is PCR.
Yeah.
It is PCR, and they're still using PCR. They could use an ELISA test or another antibody test, but it doesn't matter. Keep in mind that AIDS is like the only disease, or then it became COVID too, but this was the only disease where an antibody means you have the disease.
Right.
Whereas we were all taught when we were little kids, like once you get sick, you create antibodies, and then that means your body has fought it. Right? That's good. Antibodies are good, but they're looking for antibodies and saying, "Oh, you have the disease." This is like you going into the doctor now, getting your blood tested, and having antibodies for chickenpox, and them telling you you have chickenpox, and you're saying, "But doc, I had chickenpox when I was 12. That's why I have antibodies." Right? Everyone knows this when it comes to chickenpox or anything else, but when it came to AIDS, all of a sudden it meant that you actually have a disease. It was totally flipped on its head, and they never really bothered trying to explain that. I still don't understand how virologists can even justify that. Like, what are you talking about? Antibodies mean we fought something in every other disease except for AIDS.
Yeah.
And COVID, I guess, now, yeah.
So that was a huge area of contention for me when I was in the beginning of the pandemic. I was in California, and people wanted me to get tested because they knew somebody close to me had tested positive. And I was like, I feel great. There's no way I'm putting that up my nose for no reason right now. Like, and the peer pressure in itself with certain individuals, it blew my mind. I was like, how do you not remember when we were kids and our parents going, oh, they got chicken pox, you're going to get chicken pox if you haven't had it. And they'd have parties for this. They would almost force it upon you so that you could have those antibodies. Never have it again in your life.
No, it's a crazy, crazy thing. So I have some numbers here too. This is from the book Why We Will Never Conquer AIDS. And it is by, oh my gosh, sorry. It was co-authored by Peter Duesberg, but it was really written by another man. Maybe you can look it up for a sec, because I'm just kind of in the middle of something.
Did you do a review on this one?
Yeah, I just recently did a review on it. Sorry, I can't remember the main author, but I've been scrolling through here. And it says here 94% of the American AIDS epidemic was due to recreational drug use. So either with the homosexuals or just regular old drug users. And then that extra 6% breaks down into the hemophiliacs and honestly probably people who didn't admit to doing drugs. Mm-hmm. And he didn't go much into the fake tests and how bogus the tests are and how having HIV just doesn't mean anything at all. But whatever percentage is left over is basically those same people who just got misdiagnosed with a fake test that just really doesn't tell us anything.
So are we actually coming to the point where I guess more books will be written about this COVID than the same manner that, people have written books about with the AIDS epidemic, I guess not pandemic, and we'll start to come to enough conclusions, like you said, we'll have momentum on the side of perhaps not testing for this stuff, especially if you don't have a reason to be testing, because I've seen that more often than not in the whole COVID, this whole era, the last few years, people going and getting a test when they have just normal random flu symptoms or just a little bit of sickness. The first thing they want to do is have confirmation that they have COVID. It's like it's a weird game.
Yeah, I never really thought you needed any type of confirmation, and yeah, more books probably will come out about it. But okay, I've been looking here for there's a quote that I saved that it was talking about the fast lane, they call it the fast lane lifestyle of these homosexuals during the 70s and 80s particularly. I believe it's slowed down a little bit now because a lot of this came out. And so one of the main drugs that they were using that most people in this alternative field of AIDS theory believe was the cause of the KS, the Kaposi sarcoma, and that's poppers. And poppers, alkyl nitrates, poppers, inhalants. They're extremely, extremely toxic. They cause Kaposi sarcoma. They destroy your immune system. And the reason that homosexuals in particular were using this is because it's a powerful muscle relaxant. So it allows you to have anal intercourse without as much pain, basically. And this was highly advertised in gay magazines and sold in sex stores and porn stores. They used to have pornography stores and theaters and stuff like that, right? So where they sold these poppers. Poppers were done en masse in these discotheques and gay clubs, and it's just extremely, extremely toxic. They were also using amphetamines and cocaine and this big list, this big combination of drugs, along with alcohol, along with staying up all night partying instead of sleeping. So now they're not producing melatonin. Melatonin's a powerful antioxidant. It's a big part of your immune system. Healthy immune system is sleeping at night. So, I mean, there's most likely, just like now, plenty of responsible, regular gay people who go to bed at a reasonable time, eat a nice dinner with their partner, and, maybe have a glass of wine and stuff, and they're not at risk for any major diseases. But then you had this party animal sect that made up the majority of almost all of the AIDS cases, especially the early ones. It was all homosexual party animals and essentially drug addicts. Even if they're not on the street with a needle hanging out of their arm, they're doing even more drugs than a lot of those junkies, basically. And yeah, people in the gay community admitted this. They knew this. They knew that this was a big problem. Like, hey guys, we're taking this too far. But when most of them were convinced that it was a virus doing it, it gave them a scapegoat to continue their lifestyle too, which is one of the most insidious things here, that if we collectively had just realized that, hey, no, this is caused by drug abuse. If this is just caused by drug abuse, you need to stop abusing drugs. If that was the message, then we would have had a clear way to stop deaths from happening. And we haven't even gotten to AIDS treatment yet, right? If we just stopped people from doing drugs at the outset, this wouldn't have been a thing at all.
And then they wouldn't have gone after the medications in the first place.
There would have been no medications. Why are you going to give someone medications for being a drug addict? Right? If your disease is caused by drugs, then there's no drug to fix that. But they blamed it on a virus because the virus hunting establishment had run out of things to look for since polio, basically. A lot of virus hunters were looking for a reason to justify their existence, and even the CDC was looking for ways to justify its existence. And they came up with the viruses. And so the result was they now have to come up with drugs to kill a virus, which is not an infectious thing anyways, so good luck. And even worse, look at what we have now. There's been 30 plus 40 years of this. Instead of encouraging drug addicts to stop using drugs, we encourage them to use drugs safely. I'm putting that in quotes there for the audio people. Safe drug use. And we still see this. Oh, give them clean needles. Give them a safe place to inject in. That doesn't save them. It doesn't help them. And there's even been studies by people who believe in HIV showing that it also doesn't reduce HIV transmission at all, because HIV is not a thing, right? And so you can give them clean needles and they still are positive or negative at the same rate, basically. It just does nothing to change the HIV rate. So we've basically been encouraging people to continue using drugs and actually paying for it as taxpayers. You're paying for needles for drug addicts. And as anyone would know who's been to Denver or Los Angeles or whatever, any of these liberal cities, there's a plague of drug addicts there now who are just allowed to run rampant. Whereas when I was a kid, I'm not even that old, but when I was a kid, we used to have to hide like a little bag of weed like halfway up our butts, basically, scared to go to prison about it, which I think is kind of the way it should be, right? Because now the opposite is, oh, let's just let everyone do whatever they want. And now we have plagues of drug addicts harassing people, stealing things, breaking windows, and all this crazy stuff, overdosing on the street, pooping on the street. Like, it's become insane. Total insanity. And this has happened in part, only in part, by encouraging this idea that the problem is viruses. The problem is not drugs, it's viruses. Right? So it totally obfuscated the actual problem. And yeah, you asked, is there fraud? There was fraud from the start. The original trials for AZT were extremely toxic. These are just some of the problems I'm summarizing here. It was impossible always for AZT and for the other drugs. It was always impossible to have a blinded study because the side effects were so strong that everyone knew whether they were on the drug or not, right? You couldn't ignore it. And they're having their blood tested regularly so they could see the blood changes. AZT was a chemotherapy, first of all, by the way. It was developed as a chemotherapy, and it was actually abandoned because it was too toxic. It just killed the animals you gave it to. So it was just shelved. And when they came out with this virus theory, pharmaceutical companies just started pulling stuff off the shelves. What's some of the most toxic stuff we got? Stuff that we can make some money on, let's do it. It's probably not that evil in those exact literal terms, but they were just pulling old, never released, extremely toxic substances off the shelf and trying them out. Problem is with these, even if it was a regular chemotherapy, this is more potent than a chemotherapy. Start giving them to people, they're going to have extreme symptoms. So it was impossible to have a blinded study. Problem is there was already propaganda floating around. So all these people, and most of them were homosexual drug addicts that were in these trials, were in the trial in order to get the drug because they were told that the drug was going to save them. Remember this whole thing. They're in this predicament. They have an immune problem, or they have a cancer, or they have a chronic pneumonia, or herpes, just normal stuff that happens to unhealthy people, especially drug addicts. They had these problems, and instead of being told that their problems are caused by their lifestyle, which they 100% were, they were told it's caused by a virus. And hey, there's these rumors circulating around that this drug it's a magic bullet to kill this virus. So instead of stopping their lifestyle, they all wanted to be in these trials to get the drug because they were convinced that it would kill the virus. So in that scenario, and you have a control group and a drug group. which was impossible to blind either from the doctors or from the people, because people would get violently sick and many of them dropped out of the trials, and many of those people were excluded from the data as well. But it was so toxic that you could not possibly misinterpret that. You know that you're on the drug, or you know that you're in the placebo group. And the early version, in the very first trials, especially the first trial, they tasted different. So these guys just tasted. They were licking the pills and stuff, and they knew which one was the drug and which one wasn't. And so a lot of people in the controls took the AZT. They were trading with each other and stuff and sharing it and stuff because they all thought it would work. So they all wanted the drug. No one wanted to be in the control group, right? And so there's many people in the control group who were taking the drug, and that was confirmed. It was confirmed later. It was buried in the notes in the studies too, that the authors knew that this was happening. They buried it. And yeah, so it was never a controlled study. There's never much comparison to make between two people who take the same extremely toxic drug. Many people dropped out. Some people died. A lot of people in these trials had to be given transfusions in order to save their life, right? During the trial, right? They take the drug and the drug is so toxic that they need a blood transfusion to save their life. Well, this was never good news to begin with. And AZT was the first drug that was ever given license to come to the market without a phase 3 trial. I believe that's the fact there. It was the phase 2 trial that I'm just talking about here that had all these problems. And on that alone, that one incredibly flawed study, and it's not just quacks like me who are saying it's an incredibly flawed study. Everyone who's looked at it said this study is extremely flawed. On that one trial alone, it was approved. And that was also true for the next drug that came out years later. I can't remember its name, but there's a list of them now that are all basically the same story. Chemotherapies that were too toxic to be used for cancer, that were rushed through very, very problematic trials and given the ability to come onto the market without adequate testing, adequate safety testing. And of course, they're never going to be able to prove safety of these drugs because they're not safe, just flat out.
Well, they learned something else, like what you just touched on. The first thing I think is that they learned something else about the propaganda in the first place, and that is if they can get these individuals that are seeking a remedy for something that they assume is a virus that they're afflicted by, that they'll do anything. So if they're that afraid that they'll put themselves into a study which is absolutely unconfirmed, the A, effectiveness, and B, whether or not it's potentially more dangerous than what they've been told that they have, then they can actually do this over and over and over again as well with like the vaccine.
Well, that's what happened with COVID.
Yeah.
Right. You've got something that has like a 1, maybe 2% chance of killing you if you're an adult, and they convince you to, hey, if you have this thing, go to the hospital and take drugs that will probably kill you, right? Remdesivir, I think it's called. They nicknamed it "Run, Death is Near." It'll probably kill you. Ventilation will probably kill you, right? And some of the numbers I was seeing during the pandemic were like 80% or more of people who were going on a ventilator were dying. Well, it was the ventilator that was killing people. And so, yeah, there's a perfect example. People are so scared that if they have this thing that is extremely unlikely to kill them, especially if they don't already have health problems, go to a hospital and do something that probably will kill you. It's nuts. And people did it. And people got a poisonous experimental vaccine as well for the same reason, to avoid something that is extremely unlikely to kill you. The vast majority of people.
Well, there's major incentive right there for the absolute propaganda we saw at the beginning of COVID with all those individuals in China.
Yeah, I don't know how much of it was planned ahead of time. You know, I assume, just being sort of conspiratorial myself, I do assume that it was planned out ahead of time, but it could have been organic at the same time too. Like, go back to AIDS. Those people there was one guy, first of all, who found those first 4 cases of this odd cancer and decided to kind of raise the alarm about it, brought it to a CDC who was eager to have something to do and to redeem its public image, because CDC wasn't really doing anything at that point. There was no real infectious diseases. They were kind of making up infectious diseases like Legionnaire's disease, which we don't need to go into, but there were finding small little outbreaks of people getting sick and saying, oh, it's a new disease, we got to do something about it, trying to justify it, trying to give themselves something to do. So this one guy finds these 4 cases, brings it to an agency that's absolutely eager to prove itself necessary. Like, keep giving us a budget, please, because we need this, we need to do this, we need to deal with Legionnaires. Oh no, we need to deal with AIDS. So that situation created it where, yeah, there is incentive to create a disease, and you got all these virus hunters that need something to do. Genuinely, before AIDS, they were looking for cancer. The virus hunters were looking for a viral cause of cancer. Well, that was a huge failure, so it was pretty embarrassing. It was a huge waste of money and decades worth of research, tens of thousands of research papers, and hard to justify this entire career path for thousands of scientists and people working for the government and stuff. So yeah, they were absolutely eager to have something to do. And I'm just saying that it didn't need to be a pre-planned conspiracy. Like, okay, we're going to find some sick people. We're going to call it a virus. We're going to create some really toxic drugs. We're going to release it on these people just to kill a bunch of gay people. It didn't have to be a conspiracy at all. It could be I think the AIDS thing was mostly organic. And then there were some evil players on the inside, like Fauci, one of the people who knew what was going on, knew how flawed the drugs were and all this stuff. And they also needed to justify their own careers and stuff. So there was some people who were more in the know and who took more conscious actions that they would have known are bad. But the people like the virus hunters who actually believed in viruses totally could have, I believe most of them believed that some type of drug would kill the virus. They weren't involved in a conspiracy per se. So they didn't have to be involved in a conspiracy, a lot of these people. They could have actually believed that a drug will kill a virus if they believed in a virus. And there was only some players that knew more about what was going on. It could have been similar in COVID, but COVID seems a lot more pre-planned.
Yeah, due to Event 201 and things like that. And the coincidental election thing that was going on at the same time.
Yeah, they basically simulated it right before it happened. It seems like the biggest conspiracy of our time, actually.
Yeah. And I mean, they had so many things that came about because of it that really worked to their benefit in the grand scheme, I guess, even more so than selling a ton of vaccines. So, I mean, it's a crazy wormhole. A lot of people I talk to, they're really not ready to entertain the idea that the entire allopathic formula is just off, or that we've really been so mistaken on virus versus terrain that they're ready to, reanalyze all of it. But you have a page, Wallach's Warriors. It's for those that do not know, it's one of the best resources on Instagram and probably other accounts, other platforms that you use. But you've done this Q&A there that has been absolutely impactful. And I consider myself very healthy. I consider myself in the know about a lot of things, but you've put so much information out in these Q&As that it's mind-boggling, because you could go to your doctor, like you said you had done, and go through every angle that they have to offer and not come to some of the conclusions that you can actually come to watching one of your Q&As. So I commend you on that. I thank you for that. It's helped me in so many ways. What has the response been in those Q&As that's obviously led you to this next project that you're going to work on with the classes?
So yeah, let me comment too. We have a handful of doctors that follow us as well. We're not the smallest account. We're not the biggest account. We're a medium-sized account, but we've got a good solid handful of doctors. Real, I'm putting real in, I don't really consider it real, but they're medical doctors. Okay, they're MDs. We've got a good handful of them, and some of them have been open enough to talk to me and say, look, yeah, I understand. We don't know everything. Some of them have their own health problems. They're following our account to get insight on their own health problems because they know that what the medical world has to offer, they know better than anyone. What the medical world has to offer them isn't going to fix them. And there's been many surveys over the years too, especially with chemotherapy, asking doctors and nurses and interns, would you do chemotherapy if you had cancer? Would you go into one of these trials? And by and large, they say no, right? So a lot of time they do understand the limitations. And so the impact of that has been broad. Of course, we have people like you. We have lots of people in the industry, whether they're chiropractors or nutritionists or actual regular doctors who have come on to our side, come on to the light side, understanding this thing largely because of the Q&A. I know it's had a major impact. But you kind of want me to go into this next project. Okay, well, operating on Instagram, and we are on the other platforms too. We're doing pretty well on Facebook right now. We're growing a little bit on TikTok right now, even though I really hate both of those platforms. It auto posts to all three of them, the same content. So whatever. But operating on Instagram has severe limitations. First of all, we're subject to the whims of Instagram. Sometimes we're doing very well. We get tons of followers and reposts and all this, tons of views, and then sometimes it just dries up, and it's really beyond our control. Ask any medium or large account; they'll tell you it's a tide that comes in and out that doesn't have much to do with you. If you're chosen and blessed by the Instagram gods with one of your contents in the explore page or something, you'll do well that week, and then the tap might just be turned right off. So it's very difficult to run a business on that, right? We're not here as volunteers. This is our full-time gig, especially my full-time gig. And so having a business where one day 400 people walk in the door and the next day one person walks in the door, very difficult to plan your life out on this. Basically, it's hard to run a business on such an unstable platform. So that's one problem. Being on the story, I know, has been incredibly beneficial and efficient, because you can just answer these questions. It used to be 15 seconds, now it's 1 minute. It's great. And you get all these different questions. I can do it individually, and you can skip past them if you've seen them before. I get it. It's very convenient, but it's also very limited. I can only do off the top of my head. I'm off the top of my head right here, but I also have documents in front of me that I can fish through. I can find things specifically, and it's tough to do that on a story. It's tough to give more than a very basic answer on the story. And I realize that the basic answer can make all of the difference. For you to understand it, for someone new to understand it, for them to be given a course of action. And a lot of times it's just the action is message us. I'll have this problem, whatever it is, message us. We'll give you a questionnaire. We'll look over it. We'll give you some advice, rather than just saying it on the story. This is everything you need to do. 1, 2, 3, 4, 5. But following a list is one thing. Understanding this is another thing. So I feel, on one hand, proud. It's been over 5 years now. I'm proud that we've been able to spread this pretty far and wide. We've got a lot of people like you who now, you understand this. You can't unknow this. You get it. But I know you don't get the details. You don't understand the details. But you can in a better platform. Instagram I have a very love-hate relationship with Instagram. I'm very grateful for what it's done for us. I'm very grateful we're able to reach so many people. Awesome. But it's just by default limited. How much can you really teach in 1 minute clips? You can't. You can't do that much. I can't share that much. Sometimes I can read off my screen or something. It's just any of these short-term platforms too. People are scrolling through. You can't do the deep dive. Really, you can't. I can get medium deep dive at max, but mostly it's shallow. It's very basic. This is the basic answer. The basic answer needs to get out there. People don't understand the basics. A lot of millions, billions of people don't understand the basics. They don't understand that most problems are just caused by mineral deficiencies, and that processed foods are bad. Like, it sounds simple to us once you get it, but a lot of people don't get that. So the basic message still needs to be spread. The medium level that I'm able to do on the story is fantastic, but me being proud that we've reached so many people is one thing. And then the other thing is saying, how far can I really go with this? Are we really making the difference in the way that it needs to make on Instagram? And I don't think so. One other problem with this is, when you are doing well on Instagram or any platform, when we get a bunch of views or something, we also get 100 messages, 500 messages, 700 messages. And so it becomes something where you can't dig your way out of it, kind of with scale, right? Because if we succeed in getting the message out, now we have hundreds or thousands of people coming to us, and it's just physically impossible to actually answer them all. So this is the problem where I've been at for the last, especially year or two, we've had this mass awakening of people, probably largely from the pandemic. And now we're so busy that I'm working 12, 14 hours a day and still not getting through everything. I'm still behind basically all the time. And well, what's going to happen if we actually get like real popular? Like if we really actually get the message out there to the public, what if I actually go on Joe Rogan or something one day? It will be actually impossible to answer all of those people. So the problem is giving out lists, giving out instructions, giving out protocols, we call them. It's great for the people who follow the protocol and get their results. Fantastic. But even better to me is having them actually understand the concepts behind the protocols, and they can do it themselves. And they can teach other people to do this. And I don't even mean being a distributor for our supplement company and stuff. I've really stopped caring about that aspect of the business. But I know that me and my small team we just physically can't handle everyone. So I hope you see the catch-22 here. The more successful we are, the more time it takes, to the point where it's already impossible to fully actually give all those protocols in the first place. And then just giving a protocol doesn't make you understand the protocol. I don't even have time to explain it, right? We give advice. I genuinely don't really explain the advice because I just expect people to trust us, and they do. They have faith in us. So I just expect them to take the instructions. Most of them do, some of them don't. But we give so much information. Just you walk through the door with us, get your questionnaire. We're hitting you with multiple paragraphs. Like no matter what, you're getting a bunch of food blurbs. It's like 4 or 5 different big long paragraphs, and you're getting instructions, and you're getting a supplement recommendation too. It's a lot. And that's with no explanation. Right? I might give a little bit like, hey, this is connected to this, and this is just this mineral deficiency problem. It's very brief explanation, and then it's boom, 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 boom. Here's what you do. So I know that is limited because even those who follow the instructions don't understand the instructions. They don't understand why these things. So that's what I am shifting into now. I've been doing this for 10 years. I can't see myself only doing sales. That's what this is. Only doing sales forever. Again, with the scale involved here, we have just gained we gained like 20,000 followers recently. That's just one growth spurt out of many. If that continues as it's supposed to, because that's supposed to be your goal on social media, is to grow. Okay, we're growing. Well, how much longer can I actually answer everyone? And the answer is, I can't. It's not going to work that way. So I've got to shift more into teaching. And that's what this new thing is about. We're using the school platform. We're almost ready to launch. Got a little bit of a delay from our recent hurricane here in Houston, but almost ready to launch. And I'm very excited about it, honestly. It gets tedious answering the same questions over and over. You've seen the story. It's like thousands of times, hundreds of times I've been asked the same questions. And you got to do it with energy and enthusiasm, and you got to put a smile on. And I'm happy to do it, but it's hard to say the same thing over and over and over for years and wonder, is this really making the difference? Just me answering this question. And I think no, kind of yes, kind of, but no. So can't do it that way forever. Can't give individual protocols forever. Already totally at my limit of how much I can work. Even before we got on here, I was trying to get through as many emails as I could. There's 15 left, which is a pretty low number, honestly. It's pretty under control right now. But still, it's like it'll take the rest of the day to answer those 15 emails adequately, give a proper protocol, and you can't do 100 of them a day. Can't do 100 protocols a day. Not adequately, not with care and attention, not with any level of explanation.
How many coaches do you have that are answering the questionnaires alone right now?
On the Instagram DM, there's only one right now, and me, Catherine. Catherine has been with me for 5 years now, almost since the start of it. She's extremely dedicated. She spends so much time. I can't believe it, honestly. I can't believe it. We've had several people come in and try to do it. They realize very quickly, this is a very high pressure situation. You need a certain level of confidence. And actually, the truth is, might sound weird to your listeners, but You need to be able to answer people without fully understanding it at first. You have to, because I've been training in this for 10 years. If it took everyone 10 years to train for it, we're never going to get anywhere, right? When Catherine started, she did not understand all this stuff. I gave her a few blurbs and scripts and told her, ask me any questions you have, and she would bug me. This person has diabetes. What do I say? Basically, she has to answer them before. You have to train on the job. Because if you need the training beforehand, again, you're going to be doing this for 10, 20 years, and you're still not going to feel ready, per se. So a lot of people have jumped in and been overwhelmed by that and not been confident enough and dropped out. And I don't blame them at all. At all. There's people in there who are dying. There's people in there on their deathbed. There's people who message us, my aunt is in the hospital. What do I do? We give them an answer. 12 hours later, they message back, oh yeah, she died. This happens all the time. Every 2 weeks, probably, we get a case like that where by the time we even answer them, they're dead. So it's hard. It's hard to deal with that mentally. I get it. I'd ask anybody in the health field. It's tough to deal with people who are very, very sick, and that's part of the job. Other part is people with difficult things. So it's hard to know. You have to be dedicated to finding an answer for these people. At least that's the way I've staged it. We're not there just specializing in obesity or something. We're literally willing to take anyone who comes through the door. And it's kind of shot me in the foot. Like, I don't know every answer, but we have to be committed to finding it out. And yeah, Catherine has been the only one who's been able to do that consistently for all these years. Whereas everyone else, probably another 10 people or so, have been overwhelmed by it. Have been maybe just they've lost passion for it. You know, that a lot of people think they want to be a nurse until they go and do a couple of shifts and they say, oh, maybe I don't want to do this. It's a tough job, and the truth is you don't get paid very much for it. We make very small commissions, very modest commissions. So the other coaches we do have a bunch of coaches. What is it? 1, 2, 3, 4, 5, 6. Close to 20 other coaches here that are contactable on email. So they'll be getting less people, and they can put more attention into each one of those people. But still, every single one of these coaches is doing it because they believe in it, because they got harmed by the medical world. They fixed their own health problem. I'm saying that none of these people are doing this really as a career. A couple of them are kind of trying to get it to that point, but honestly, if you just soberly thought about it and like, what am I going to do to pay for a new house or something like that? Don't go in the health business. Like, just don't. Go be a construction worker or open a coffee shop or many other options where you put the same time and effort and enthusiasm in, you'll make a ton more money. So it's hard to get people excited about doing this job, especially on the level of the Instagram, because it is the most popular. We do get tons and tons of people coming to us, and yeah, it's intimidating. And let me just throw something else out there. I know you got lots of questions and stuff, but people might be interested in this too. I've been approached by multiple clinics over the years. Chiropractic clinic, acupuncture clinics, health food stores, various types of clinics. When they see the numbers that are involved, they're not interested anymore. And it doesn't mean they're bad people. It means that they're sober people understanding that if I'm going to keep my business open, I don't know if I should do this. Keep in mind, with a person with a serious problem, we might spend an hour with them. It might take 10 minutes to answer an easy protocol. It might take an hour to answer a cancer case or something like that. With the amount of commission you will make on our products specifically, and I don't mean to like bash our company or anything, there's no one else in the game when it comes to the 90 essential nutrients, but we don't make very much money. The amount of commission that you'll make on a customer that you need to spend an hour with is less than it'll cost to spend with that hour, right? That less than an hour of a professional's time. So you can't really do it in a clinical setting. Don't mean to be too pessimistic. There are a few clinics that do use our program, but they have to sell other things. They have to either charge you for just being there or charge you for like hyperbaric treatment or red light therapy or whatever else it is that they have. We even opened a health store. I helped to open a health store. It's still there. We could not keep the doors open with supplements alone. We had to sell other things. We sell water and water filters and frequency devices and a bunch of other stuff in the healthy living umbrella. We'll sell crystals and all kinds of stuff because there isn't enough money on the supplements themselves. And I've even had health stores, supplement stores, tell me, I can't afford to sell your products because even though it makes total sense, yeah, they've got all these nutrients all in one product. Well, that means my customers now are not going to come in and buy B1, B2, B3, C, D, E separately. And there's 90 at least essential nutrients, right? This is how they make their money, is by you buying everything separately. It's the only way that health food stores exist. They're not interested in doing multi-products. Even if they will take it themselves, some of them will. They'll use it themselves. That's the product that they use. But they can't sell it in their store, or else you will not buy your products individually, and they will be out of business. And naturopaths do this too. They send you out the door a big basket full of products, $400.
Yeah, that's incredibly unfortunate.
Well, it is a situation. And so we're not going to be replacing mainstream medicine in any sense, really, because there isn't enough money to be made, which is also good news for the consumer, though, because you can get all this stuff a lot cheaper if you bundle it instead of buying it one by one. It's just there's not going to be health food stores that are being kept in business, unfortunately, and clinics will not stay in business if they were doing it this way. The chiropractor needs you to keep coming back. We love chiropractors. So got chiropractic friends. We've got chiropractors in the business, but they understand that they need you to come in for the chiropractic care because that's what keeps the clinic open. If there's no chiropractic care, there's no clinic. It doesn't matter what supplements they sell. That's a little bit of extra money. If it helps you, that's great. But if it helps you to the point like me, where I don't need a chiropractor anymore, if that happens to all your clients, then you're out of business.
Oh, I guess that dilemma exists throughout so many different networks and so many different establishments that we're kind of wishing upon a lot of people's livelihoods when we want everybody fixed. But let's be real. What's better?
That's why I said from the outset, and I always thought that the goal was to make ourselves redundant. I understand that, whereas medical world and people who have clinics and stuff, and they've got big car payments and house payments and stuff, they can't really accept that. And again, a lot of them, I know they actually do want to help people. They're not evil people that just want to milk their customers. They just understand, I have to pay my house off. I got 4 kids or whatever. They have to do it. Whereas I've been prepared since the start to make myself redundant. I've been saving, I'm not in debt, all this stuff. I'm prepared. But it also doesn't mean we're going to go broke. It just means that we can't pay the overheads of a clinic, right? Just a clinic costs money. It doesn't make sense to spend an hour with a customer, which is like a minimum to really allow someone to understand this. Doesn't make sense to spend an hour with a customer to sell them a batch of products that you're going to make $30 on. You can't do that. But you can do it if you don't have overheads. And so that's the only way that we've been able to do it. So we do it on Instagram and stuff. I don't have overheads. I don't have bills to pay other than my own bills. So there is enough commission when there's enough people, enough customers, especially residual, that you don't have to deal with them every month. Once they're good, they're good. They just stay on their program and you just get the commission automatically. That's amazing. It's just not enough to pay for a clinic or to pay for the lifestyle of the modern medical doctors. It's not going to compete with that. Not without massive scale. And again, you can only deal with so many people. It takes years to build up the type of a customer base where you can be fine. Like my bills are paid, right? I'm not going bankrupt here. It's just the job itself should become irrelevant. And then hopefully that does leave us with a customer base who wants to stay on the product so they stay out of pain because their nutrients aren't being put back in the food supply anytime soon or ever. So you're going to need these products forever. And so there should be a profit margin there forever. But yeah, you're asking about this program. That's the point of this program, is there's limitations to doing it through sales. You can only deal with one person at a time. We don't randomly give recommendations. We give specific recommendations to individual people through a consultation, which is time consuming. And I'm always had a very difficult time recruiting other people to do it. Saying, hey, we're going to do this. We're going to help people. We're going to answer anyone, even if they don't buy our products, even if they're in a country we don't ship to, even if they buy their products on Amazon and we don't get a penny from it. The policy has been, I'm not trying to make myself sound like a saint here. This has been the policy from the beginning. And I've had problems maintaining people because they understand that some of my policies are unprofitable. Policy is and will be answer everyone to the best of our ability, give them the best advice that we can, no matter how many times they come back and keep asking questions, and no matter how little or more money we make from it. The amount of money we make from them is irrelevant to my business model, which kind of sucks as a business model, but I feel it's the most honest way to do it. And yeah, it's only minimally sustainable with people who are extremely committed to the message and to the business itself and understand that you're going to need actually years probably to even build a respectable income. You better have a job on the side. Right? Catherine has a job. My other coaches, almost all of them have a job, or they have some family money, or their husband takes care of them or something like that. Like, this is not their primary income. And this business always was promoted as a side thing. Only few of us go full time, and it's tough. It's tough to do full time.
Well, what you've done is an incredible act of service and a business. On that note, you have also authored some amazing books, and this last one, everything you need to know about healthy blood sugar, or about blood sugar.
Mm-hmm.
So, are you writing anything at the moment? Or you got another?
I'm actually, yeah.
Yeah, go ahead.
I'm working on updates.
Okay.
I'm going to update the blood sugar book, and I know you're not even supposed to mention this because then people don't buy the book. They wait for the new one. Well, I'm honest here, okay? I hope you appreciate it. So I'm updating the blood sugar book. It's not going to be a massive update. It's just I got some stuff to add to it. I think the blood sugar book is the best book, honestly. And the feedback that I get from it is that it is the best one. It's at least it's the most comprehensive, and it's about blood sugar. But the subtitle is strategies that to conquer almost any health problem, because it is true that the same strategies that you would use for a blood sugar problem can be used. It's the same thing for basically everything. It's all the same root causes. It goes into great detail in digestion and stuff. I'm very proud about that book. I'm just going to update it a little bit, and then I'm going to do a massive update of fake diseases. It's going to be a full second edition. Does that mean you should wait to buy it? Honestly, fake diseases #1 right now. It only costs $10. It's still going to be worth it. I am going to raise the price on the new one. It is going to be substantially different, substantially bigger, and it's going to take quite a while to finish that, honestly. But yeah, we're always working on something. My best friend Chef Norman has written a cookbook for Dr. Wallach as well, and I'm co-author of that, kind of, even though I'm not on the title. I'm a secret co-author. And we're working on a couple more cookbooks as well. One for the budget, the 25 ingredient cookbook. We're working on a apps and snacks book, appetizers and snacks. That's our bestseller, is the cookbook, by the way. So, yeah, pretty important. That gives you how to cook this stuff. We're giving pretty specific food information. This is how to do it. So the cookbook has done very, very well. And Fake Diseases is my bestseller. So I'm going to update that nice. Really thoroughly go in on the AIDS and the cancer and add some stuff to it. Adds mental health chapter and women's health chapter. It's going to be a whole new book, basically. That's what I said. But it's gonna cost more than $10. Amazon raised its print prices anyways. I have to. So this is actually, I was like, am I just going to raise the price? Because now I'm hardly making anything off it because they raised the print price. Or do I add more value to it? And the answer is add more value so I can justify a price increase, because I like things to be affordable. And if I'm going to charge $20, it better be a great book. I'm a book addict, right? I'm not going to spend $20 unless I'm really confident it's going to be great, because if not, then if all my books cost $20, that costs more than a heroin addiction to me, so got to justify the value there. And I've been working on Dr. Wallach's books as well. We just finally got approved for an updated version of his book called Let's Play Doctor, which is sort of a manual on, you can look up different diseases and see what he would do about it. We just did a big update on that. This took me all year. Had to fight with Amazon to get it published. Just finally got it approved, but I'm waiting on the cover. But like by the time this gets posted, probably it'll be done. It'll be on Amazon. If you look up Let's Play Doctor, the newest version, you'll see it. It's 7th edition there. And he's got a bunch of other books that I'm committed to helping him update and get them on Amazon, because he's still doing old school print them and ship them himself. It's nonsense. This 21st century, we got to change this. They need a solid update anyways. So one by one, we're doing those updates. And yeah, lots to work on here. I was thinking the next one after the fake diseases might be, hey, why everyone is wrong about the blue zones, the long-lived people, because everyone's got a piece of it right and a lot of it wrong. And also been working for about 8 years on a textbook going through all of the 90 essential nutrients, and I'm not done anywhere near that yet, but it's come a long way, and hopefully within the next few years that'll be completely done. But that'll be like the magnum opus. A lot of work here, always working on something.
It's inspirational, bro. It's inspirational. 100%.
Well, we do need this stuff, especially actually that textbook version. It just doesn't exist anywhere. There's textbooks. I have a bunch of textbooks on vitamins and on the main minerals that are out there, but hardly anything about the trace minerals, the rare earth minerals, and there's nothing that goes through all of them comprehensively. So Amazon gives me 860 pages, I think. I'm going to fill all of them. There's 90 nutrients with 800 pages. You're less than 10 pages each. I'm going to cram it in.
So they have heavy restrictions on both the content, the amount of content, the way you can title things. They have just an entire checklist you have to abide by, or what?
Well, in terms of censorship, it's pretty easy to slip past censors, I think. I think Thomas Cohen got in trouble because he's a pretty big author and it received a lot of attention. So yeah, they took that book off, but there's plenty of books that slip past the censors. Don't put certain words in your title, I guess. But even though we had this crazy censorship era during the pandemic, it looks like it's lightened up quite a bit. There's quite a few books that have COVID in the title, and they're not censored, and they're great. They're full of great information. Virus Mania is a great one, by the way, that has its latest version. Has COVID in the title. Virus Mania is very, very good. You mentioned RFK, Robert Kennedy. He just last year, a couple of years ago, released one on Fauci. That was a great book, actually. I know a lot of people don't trust Robert Kennedy, but that book was excellent, and it's not censored. It's there. It's on Amazon. So, I mean, yeah, there is a level of censorship on Amazon. I don't like them. I don't trust them. It's just nobody can beat their distribution at all. 100%. So I'm stuck with selling them on Amazon right now. There is no other option for me to get you a book at a good price at free shipping too. It's not possible. So it is what it is. Printing is still an expensive business, and their offer is great to the author and to the customer. Whatever. I don't like them either, but they are what they are. So there's page limits. You can only print so much, right? And they're using relatively cheap printing techniques. Like it's not a textbook, even though they have hardcovers now too. And the hardcovers are quite good quality, actually. There's levels to printing. They're not at the top level. You can't bind 1,500 pages together easily. It's a different process, so they cap it at 800 something. It's totally reasonable. There's no conspiracy there at all. But also, if you print stuff that's already been published, they have an AI system that screens it, basically. That's why I had to battle with them about this Let's Play Doctor. I'm like, this is a new edition. You got to get permission from the old author and stuff, which is totally reasonable. I'm not Dr. Wallach, but I'm publishing a book with Dr. Wallach's name on it. What's up? Why are you doing that? Let's get permission. Reasonable. It's not a restriction. It's not censorship at all. But it can be a little bit of a hassle. And yeah, they scan it automatically. Has this been printed before? Or are you ripping somebody else's work off and stuff? Reasonable requests here for the most part. If it's your own book with your own name on it, where nothing exists from somewhere else, it's all totally new, it'll be approved in like 2 days automatically.
Yeah, simple vetting makes sense for sure.
It's a good system, honestly. For everything there is to say about Amazon, I have no problem with their book distribution system. It's an excellent thing, and it's given a lot of people like me the power to publish where we wouldn't have had the power before, because Amazon might have some restrictions, but I promise you, no one's publishing fake diseases as a publishing house, right? RFK has a big enough name and connections where he can get a publishing house to do it. But someone like me, you're not going to see me publish anything. I'll be restricted to a blog in a past era, right? Or pamphlets. I'd be out there on the street selling my pamphlets, because printing has always been expensive. It's always been difficult. And distribution has always been the crux. How many units can you sell out of the trunk of your car is pretty limited.
Well, that's another thing that people really need to know about you, and another reason to go to you directly is for your book reviews. I don't know another book reviewer who's got the amount of book reviews and the honest opinions that you put forth on Instagram, at least, at all. So thank you for that as well.
Yeah, you're welcome. That was never even intended to be a real thing. I just kind of was keeping track of my own books at the beginning. Now I actually just write when I finished it in the book itself. I was losing track of things. But yeah, a lot of people have said this, like, I can't believe you give negative reviews. It's weird that all these other book reviewers, literally all of them, I know no other book reviewer that will give a negative review. What's the point of a book review if you won't dare say something negative about it? Like, they'll bend over backwards to find something good to say about it. And I'll give credit where it's due, but some books are trash, and like, don't waste your time. I just wasted my time. Don't waste your time. That's what the purpose of this book review is. This is worth your time. This one will blow you away. This one's kind of all right. I don't know. Make your decision. This one is trash. Not all books are good. Not all songs are good. Not all movies are good. Like, what would you open the newspaper for movie reviews if you knew that it was all just going to say, oh, this movie had this great thing in it, and they didn't mention the plot holes, and they didn't mention the immaturity, and whatever. It's crazy that maybe there is other ones out there, but I'm not aware of them. Crazy that the whole book review Instagram industry is just pure positivity.
Rogan, do you listen to Rogan's podcast?
I don't listen to any podcast, honestly. I used to. I used to have time.
So, real quick, did you catch the segment with Eric Weinstein and this last one he did with Terrence Howard on Joe Rogan by any chance on peer review?
No.
All right.
Tell me. I saw clips.
Yeah, I'll have to send you this clip directly, because he goes into peer review, how it came about, and Robert Maxwell, Ghislaine's father, was in publishing, and how he kind of muddied the scientific waters with the peer review in itself. And when you just said that you don't know other people that are giving poor reviews, I couldn't help but think about that segment, and the fact that Weinstein went on this podcast to basically give a review for Terrence Howard's work and the things that he was perpetrating. But no, with that said, you're dead on. Your book reviews are amazing, because they do save so many people so much time on some of the ones that just need to be eliminated from their thought process, and really appreciative of the ones that you do endorse. And the list I already have a list that's too long for me to get through the whole thing, but when you give an outstanding review for it, I put it to the top. So thank you for that.
Yeah, you're welcome. And honestly, I admit and I agree that this is a valuable service. I wish I had somebody that would give me reviews so I would stop reading bad books. Oh my gosh, I've wasted so much time on books that were not worth my time. Let me read something else from this AIDS book that I was talking about earlier, the Why We Will Never Conquer AIDS. At the very end of it, they're talking about this peer review thing, and I couldn't agree more. Under the peer review system, a scientist's access to funding, publication in journals, ability to win prizes, invitations to conferences are all controlled by his peers. This absurd situation puts one's competitors in charge of one's career, a direct conflict of interest. Imagine if every new automobile or new computer had to be approved by competing corporations before being released on the market. Products would cease improving, and the market would experience a steady decline in quality. Innovation and competition would die. Such inherent problems have led to public criticisms of peer review for the last 20 years. And this book was written in the 90s, so 40 years. With 50 years now, I guess. Wow. We're getting old. With various congressmen and even the Office of Management and Budget voicing objections to the system. So, yeah, I mean, it's a weird situation where if you want to publish something that goes against the current dogma, you're not going to be able to because all of your peers believe in that dogma. It's just, and it becomes an echo chamber. And I experienced this. It's not a credential. I don't bring it up very much, but I did work in science for a brief period in marine science at the University of Sydney. And I was helping a couple of people with their PhD projects. And so I was witnessing this and involved in this, writing papers and submitting them to journals and stuff like this. And we knew we couldn't say anything bad about climate change, first of all. And we knew that we had to, if we wanted government money or any money from anyone, and we were mostly funded, by the way, in our group there. We weren't that dependent on outside money. But the main project we were doing was a government project. And to get those government grants, you have to use the keywords of the day. Climate change, this is over 10 years ago, but it was like women's rights and indigenous rights. This was in Australia, so you got to use indigenous rights. You got to have something to do with these keywords, or they're just not going to get funding. And if you were to write a grant that's like, hey, I don't think this is correct, I want to disprove this, you're not going to get it. You're just not going to get it, period. From a private organization or a government, it's not going to happen. It's a very, very, very strange situation. And it was when I was there that I was a pro climate change guy before. I was a liberal, burn the system down type of crazy. But I believed in climate change, and we were working on climate change. We were in the climate change industry, basically. We're gathering data that we knew was going to be used to push the climate change agenda. And it was there that I learned that it's a scam. I learned that it's a hoax. And when I started bringing this to people I trust, people that are smart, a lot of them would admit some of these points. Like, hey, the way that we get this data point, that everybody says this one thing, but that's totally bogus. On the whole foundation of it's bogus. Oh yeah, it is. I would get a lot of them to admit that, yeah, what you are saying is correct. But they wouldn't say this, but will we be able to change course? No. You will not be able to keep your job. You can't teach children this, right? The students this. I was at one point helping run a master's course, and it was a computer model course, but part of it they had to write papers, and I was allowed to grade those papers. Bit wild, by the way. I have no degree at all, but you show up every day and do a good job, and you end up getting responsibility. So it was amazing to me back then too. I was just some punk kid. I thought I knew everything or whatever. You drop those ideas when you get older, but I was fully aware back then that this is like way beyond me, but I'm being allowed to mark master's papers here. So, okay. So I'm marking these papers, but I'm already now believing that climate change is a complete scam. And people are saying things in these papers that I know are unsubstantiated, but they've just become dogma. And I got in trouble for giving them bad marks. You can't fail people. You're not allowed to fail. And some of them are actually just objectively bad. But the bar is set so low that's just like, you got to have 5 citations in this article or something, and you don't even really have to make a point in the paper. So I'm giving people bad marks, right? Talking about bad reviews here. I'm giving people bad marks, and I got in trouble for it. You can't give people bad marks. People are just going to be passed through the school system, and these people, this scared me back then. Like, these people are going to become scientists. This is a science program. They're either going to get their master's here and stop, or they're going to get their PhD, but they're going to be working in this field, and they don't know what they're talking about now, right? And they can't write a paper that makes any kind of sense now, or it makes a point now. What is going to happen, and what has happened since then, before then, during then, is we've got this paper mill, diploma mills. People are getting all kinds of masters and PhDs, and I've seen fraudulent data, by the way. I've witnessed it firsthand, and I've talked to several people who were involved in it firsthand. Not that they're proud of doing it, but that liberties are taken in order to get the PhD. It's more important to get the PhD than it is to have correct data. It's more important to pay your bills than it is to stir the pot and all this stuff. There's a lot of weird stuff in science, but yeah, it's become a paper mill where papers are just poured out that don't really mean anything and that don't further us in any way. This is true in medicine. It's true in climate change. It's true in science in general, that most of what's coming out is just irrelevant. And that's all it is. It's what the whole AIDS establishment thing was. They create a business for this, and people are still publishing stuff on AIDS today, even though it's completely irrelevant. It's a weird situation. I'm not sure how we got started on this. It started with book reviews, but yeah,
all completely relevant, and hopefully we are seeing the sands of change. The time is coming. I mean, if it's not upon us now, it's going to get dark before it gets light, right?
Well, the people who lost faith, we go back to health here. The people who lost faith in health, I do believe at the same time they're losing faith in science.
Right.
And I know a lot of people are worried about that. Oh yeah, this came because you brought up the Joe Rogan and the peer review thing. And yeah, I think a lot of people are worried about this. Like, oh, but we don't want to lose faith in science. And I'm thinking like, that's exactly what we should do. That is exactly what we should do, because you don't even have to be on the inside. I was only on the inside for a little bit. You can look at it from the outside. It's nonsense. It's full of careerism, which is not a bad thing. It's an understandable thing. You need a career. But when your career is dependent, like we said earlier, on your peers, then you are going to create an echo chamber no matter what. That system only has one direction it can go in, and it's only going to continue doing it, and then it's going to become harder and harder to unbury ourselves from those dogmas. And this is why it's now blasphemy to say that climate change isn't real, or that it's a hoax, or that there's fake data. It's the same with viruses. They're never going to let go of this. The people who are inside of that are never going to let go of it. It is going to take a new generation of people who are brought up with new ideas. The problem is those new ideas just aren't being taught in universities. Those doctors that I mentioned that are on Instagram and stuff, they didn't learn that salt is essential in school. They had to read some alternative book or something like that when they got out of school. They just happened to get their MD and then realize some of this stuff is bogus. They didn't learn it in school. They're not going to learn it in school. Don't mean to be too pessimistic, but we don't need to have wishful thinking either here. I do not think the university systems are going to change. They are so deeply entrenched in what they believe, whether it's medicine, climate change, etc. It's not going to change from within. The only people who have changed that I'm aware of have changed from without. And that's without the scientific establishment.
There is pressure coming from large accounts now. Candace Owens in the last 2 weeks made ripples when she called it the cult of science, and then laid out her explanation, which, I don't agree with everything she was saying, but she did hit on some points that were really, really pertinent for people in their fields to be confronted with. And I think that was one of the best things that Weinstein did point out in that conversation, is that, look, we have to start confronting each other within this network, within science, within even mathematics and just physics and different departments, that they know they're being intellectually dishonest with each other all the time. They need to start confronting each other on it, because the pressure from without is going to increase. It's inevitable.
Yeah, and honestly, sometimes it's not even like something is off. Sometimes you can just get so eclipsed by what's going on. I'll give you another example in marine science, because it was one of the craziest things I ever saw. So I was there at the Sydney Institute of Marine Science, where I spent a bunch of my time there. It's a beautiful facility, billion-dollar facility. It's completely set up for whatever we need to do, chemistries, and run experiments in tanks where the water is brought in from the ocean right there. And it's great. Like, for what you need to run ocean experiments, top tier, awesome facility. And I had a lot of time. I was there morning to night every day. I walk around. I like to see every other experiment that's going on there. People are doing their PhD projects and stuff like that, and some other projects. I like to be aware. I'm nosy and I'm interested, and I'm trying to, claw my way up in this field. So I ask questions too. What experiment are you running? What are you doing here? What do you expect to see? What have you seen so far? I'm just bugging people. I'm an annoying kid asking tons of questions to a lot of people. And some people were kind enough to answer me. And I learned that there were several experiments going on in that facility about ocean acidification, which might be something you might have heard of like 10 years ago, but no one really talks about it anymore because the oceans are not becoming acidified. It's just like sea levels are not rising. You can only say it for so long before people say, look, it's not rising. You need to stop. You're sounding crazy. So oceans will never become acidified because they're coated in limestone, basically. The calcium that is the bedrock of all oceans, basically, will always buffer the pH. So it will never increase substantially. You could raise the pH in a bay or in a river or something like that. Rainfall comes, the pH changes, but it's never going to happen in the ocean. Just putting that out there. So lots of people were running these experiments at this time because this is the heyday of climate change research. Basically, this is 2012, 13, 14. And everyone believed that the ocean was going to become so acidic that all the reefs were going to die, and so all the baby fish, they got nowhere to grow up. All the fish are going to die, and oh my gosh, it's an apocalypse, right? It was very popular at that time, and probably still is, to believe that we're heading towards a 5 or 6 degree increase, and it's going to be a total apocalypse, especially the fishing industries and the marine science world. Everybody's worried about this, and that's fine in theory, I guess, but the experiments that were actually being done, because I could see them firsthand and ask the people who are running them, what are you doing to actually increase the acidity? Are you bubbling CO2 through it? That's one thing, right? But these are glass or plastic tanks with no granite in them, no limestone in them, no calcium in them. It's too controlled. They miss something. They miss the calcium. So it's in a plastic tub or it's in an aquarium, and they're measuring, starfish or little fish or snails and worms and basic sea creatures. But I'm asking them, how are you acidifying the tanks? And the answer is hydrochloric acid. So it took me about 15 seconds to think, well, of course, if you put hydrochloric acid in a fish tank, your starfish will suffer. They might die. Right? But see how tangled up these people got. They didn't understand it. They didn't see that. They were so stuck in the forest. They were standing with their nose touching a tree. They didn't understand that the data that you're gathering is just absolutely useless, right? It's one thing to suppose that rising CO2 will increase the acidity. That's a theory. But to test that theory of what will happen by adding hydrochloric acid to a fish tank is insane, right? Especially with no buffering system in there at all. Like, again, any aquarium enthusiast will know this. They have pH test strips at home so that they don't kill their fish. Like, obviously the fish are dying, but you're getting papers that are coming out and saying this is what's going to happen if the oceans get acidic. No. The paper should read, this is what happens when you add hydrochloric acid to a fish tank. But that'll never get published because people aren't looking at it that soberly, because they're so caught up in the hype and the careerism and everything at the echo chamber that they literally couldn't see these basic mistakes. And one of these projects, every now and then, all the students or the PhD people or even anyone who's doing a master's project, when they're getting ready to finish or they've just finished, you have to put together a PowerPoint about it, because you have to present that to your doctor, like your professor. There's a team of professors basically that you've got to give your thesis to, so that they give you your master's or they give you your PhD. So you got to practice that. Basically, you got to practice your speech, and then after you've done that, and if they do approve it or whatever, you're good. You publish it. You have to go to at least one conference, right? I don't know if this is like a bedrock rule here, but this is just the common way that things go. After you finish your project, you have to go and present that first to your peers to get approved. That's I forget what they're called. That's a team that is overseeing your whole project. Anyways, your sponsors, I think that's the word. You got to give it to your sponsors, and it's just common practice where you've now got to go and give that talk. You've got to present your thesis elsewhere. And usually this is like a reward, right? You've done all this grueling work and long nights and stuff. You had to apply for grants and go through this whole process. Once you're done, you get to go to a fancy conference in some nice location, basically, right? It's something that people look forward to. But my point is, you got to practice that ahead of time. So we have two places. both in the Sydney Institute of Marine Science and at the University of Sydney, where people would be practicing their speeches. And I would go to them just for fun, just to see what other people are working on and just to learn and whatever. And yeah, it was at one of those presentations where they're going into ocean acidification, and the whole thing is about the consequences of ocean acidification. And I knew this project was being done downstairs in one of those bins with using hydrochloric acid. And I was at the back, very back, and I stood up or raised my hand during the question period and asked, how did you raise the pH in that experiment? And they did very shyly answer hydrochloric acid. And I didn't have anything else to say. I'm not there to start a debate or anything. I'm quiet. I just wanted to see what the reaction would be from the audience. And the reaction was complete silence. And the speaker just moved on, right? It's hydrochloric acid. And then there was this awkward pause. And they just moved on. And nobody else had another question. Like, we just listened for like 40 minutes about the consequences of acidification. And yet you never mentioned that what you really did was put hydrochloric acid in a fish tank. And this is supposed to be a master's thesis or a PhD thesis or something like this. Like, my gosh, science can get insane.
This is how Fauci did his Beagle experiments, huh?
Well, yeah, and this is how you get test tubes. You hear every week, oh, this thing's an antioxidant. Oh, this thing's a carcinogen. And what it really is, and it's hard to even find and understand in the paper, is a test tube with a protein in it or something like that. And, a little group of human cells, specific human cells, and it killed them, or it's stupid. And we're not test tubes. Right. We're not just like the ocean has calcium to buffer the pH. We have thousands or millions of different buffering systems and different enzymes and different things. So something that's carcinogenic in a test tube doesn't mean very much, and something that's an antioxidant in a test tube also doesn't mean very much. But this is where you get this never-ending mill of hype pieces in scientific journals and in regular speakers too. We jump all over these things. You want to give stuff like 10 or 20 years before you get excited about it, usually in the health field. I don't trust anything that's new in the health world, basically. Give it some decades to really sink in and figure it out, because a lot of the early stuff is on test tubes and it's just nonsense. And yeah, every week in newspapers and all this stuff, you see this new substance has been identified, this new amazing antioxidant, this new anti-carcinogenic thing, or this new carcinogenic thing. And really, it was done in a test tube. And the authors are cranking out papers on these test tube experiments. And it's just silly. It is way more expensive and difficult to do a human trial. And that's why most of them are not done on human trials, or animals for that matter. It's expensive and it's long. It takes a long time. You want to write 70 papers? Don't use mice or rats. It'll take too long. Definitely don't use humans or apes or dogs. It'll take too long.
Well, man, I'm sorry I've kept you over the time that we agreed to. This has been a riveting conversation, quite enlightening, and I'm sure we could dive into even cancer and some of these other things in that same regard for a lot longer. But tell everybody where they can find you. I'm going to put everything in the show notes. I'm going to put your book review page. I'm going to put Wallach's Warriors in there, not us. But where do you want people to come to you at this moment? What are you pushing the most? Where would you like to lead people so that they can actually come to the answers, as opposed to you having to answer a million questions on the Q&A that are the same?
Well, first of all, I didn't know we had a time limit, by the way. This is one of the shorter time limits. Yeah. We usually go a lot longer, and that's okay. I'm prepared for whatever.
Oh, man.
But
it's been a pleasure. I appreciate it. I would dive into exactly that, the cancer. I mean, is that exactly how we have the cancer treatments that we have right now? The same thing, peer-reviewed, accepted terminology, the poisoning with the poison. And do you have any insight on what the next step for cancer treatment should be, and what people should do when they're, diagnosed?
Yeah, so we can totally dive in here, Josh. The people who listen to podcasts, it's not everyone. Not everyone listens to podcasts, but those who do, a lot of them are truckers or Uber drivers, or there's something where they have all day. I got coal miners who listen. They're like, no, we listen to podcasts all day. So we don't need a short
it,
time limit.
it's one of those things. I have people that come to the video page and are like, oh, I wish I could listen to this longer. And I send them to a Spotify to just listen to the audio. But I've kept mine generally shorter just because I found so many people. The attention span of the majority, it seems like, is far less. But no, I'm stoked on that. If you could actually dive into that a little bit further, let's go.
Yeah, it's true. The attention span is a problem, but are we speaking to the majority, or are we speaking to the people who are going to listen?
Right. Great thought.
Right. I said at the beginning, we do this one person at a time, one post at a time, one podcast at a time. My podcast is not extraordinarily popular either. It was originally, then it got taken down. Never quite recovered, honestly.
Who took you down, out of curiosity? Was it Spotify or?
Spotify. Spotify. They bought Anchor. Anchor took me down.
Yeah.
They will never get forgiveness for me. But yeah, there are some people listening right now, I bet, even if it's one person, 10 people, 20 people who are probably really interested and may not have heard this before. And so, yeah, they should know that it's not just AIDS. It's not just COVID. Often you brought up cancer. Cancer is where a lot of people will default the line to, right? They'll say, oh, it's fine to eat organic food if you want. It's fine to play around with your diet if you want. It's fine to take vitamins and minerals if you want. But if you have cancer, you better go to the doctor. That's where their line is for a lot of people. It's a semi-alternative, basically, kind of. And they might even go as far as to say, hey, maybe some integrative, that's what they call it, integrative therapy will be useful, like where you do the alternative and you do the conventional. The problem is they're like oil and water. They do not go well together at all. One is designed to support the body. The other one is designed to kill cells in the body. It's designed to damage the body. This is not an evil conspiracy saying that about chemotherapy. It's designed to kill cells, and they hope for the best kind of thing. So cancer research, you do see a lot of this test tube stuff, like this is a carcinogen, this is not a carcinogen. You see a lot of stuff on epidemiological research, which means they look at like populations. So why does this country or this town have more or less cancer than the next town? They'll try and look for correlations there. Somewhat weak, but it can be very interesting. Epidemiology can be very interesting. There's big differences in the cancer rates of different countries. So clearly something about what they're doing, how they live, where they live, something is causing less or more cancer. There's also very big differences between jobs, occupations. Different jobs can put you at different risks for cancers. It's very interesting. But it doesn't usually tell you what causes it. It just gives you a little bit more of a picture of a risk factor. So there's epidemiology, there's test tubes, and unfortunately a lot of stuff that comes out today is those two. It's test tubes and it's epidemiology. And I'm guilty of this as well. Sometimes epidemiology is all we have. We're looking at different populations and different people, checking out their lifestyle, seeing what kind of patterns that we can come up with. It's not solid, but it's something to start with. The problem is, a bigger problem here with chemotherapy, because chemotherapy, radiation, surgery, these are the only things that the mainstream medical world does. Decades ago, it became immoral, unethical is the word. It became unethical to withhold chemotherapy. So when they're doing trials, this is true, this has been true since like the 80s or even before that, you will have a hard time finding very many trials. There are a few dozen out there that I'm aware of that were done with placebo controls. I already mentioned the problem with placebos when it comes to very toxic stuff. Just like in the AIDS trials, chemotherapy was always difficult to do double-blinded because both the doctors and the patients know who's on the chemotherapy based on the side effects. So it's almost impossible to unblind it. And in a similar situation, people don't want to be in the placebo group. They genuinely think the therapy is going to help them, so they want the therapy. And sometimes they can get it, or they can drop out if they're in the placebo and enroll in another trial, hoping to be in the in the active group. There's also a bunch of people, not so much in cancer research, but in a lot of different research categories. There's professional trial takers, for people who go from trial to trial. They get paid to be in trials, and so they'll try a bunch of different drugs. This can confuse the data quite a lot as well, because you could have a guy in the control group who he does 6 trials a month. That's his job. Seriously, this is a real thing that exists. The average person doesn't want to be part of a drug trial, right? Do you want to be part of a drug trial? Even before you knew this stuff, right? You'd be like, what, experimental drug? No, thank you. No, thank you, right? But some people are desperate enough or stupid enough or have no other options to do this. And it is a thing that can happen. And just saying, that is one factor. But in chemotherapy, the same kind of messing around can happen. You know, you get 4 people who die prematurely, and they could say, oh, they died of something else, or they can exclude them from the data. This has happened. This is not just me making it up. Excellent book on the subject. It's called Questioning Chemotherapy. Maybe I could get that for you and get the author name for you, but Questioning Chemotherapy. It's a pretty famous book, and I think the latest edition was around the year 2000. And there are other books, but they all touch on these same kind of problems, where there's lots of ways that you can manipulate the data. And it doesn't have to be overt like this, like excluding deaths. It could be cutting the trial off early. It could be measuring a rate of reduction rather than an actual outcome, like measuring tumor shrinkage tends to have nothing to do with actual length of life. So you might see a study that says, oh, they get a 60% improvement or something. And what that means is a tumor shrinkage. But you look at the actual length of death, the actual, how long do they live any longer than the other group? And it is usually no. It's usually no. Even in the few cases where it has been demonstrated in proper trials that chemotherapy has extended life, it's literally usually weeks or months at most. It's not an impressive, like with a control on a placebo, they would have lived 15 weeks. Like we're talking about super deadly advanced cancers here. They would have lived 15 weeks on the placebo, but they lived 18 weeks or 28 weeks on the drug. Meanwhile, they got their quality of life ruined in those last weeks, you know, and it extended their life like almost nothing. But you might see that it's like example, 10 weeks versus 20 weeks. That's 100% increase. That doubled their life expectancy, right? But it went from 10 weeks to 20 weeks. Who cares, right? At the cost of these drugs, who cares? At the cost of to the health of the patient, the quality of life of the patient, who cares? I don't know about you, but if I had 6 weeks left, I'd rather go fishing than be in a hospital, lose my hair, be vomiting every hour, and diarrhea and you know, painful sores all over my body and my face and my lips, and just terrible types of quality of life stuff that, and you know, your family's not really allowed in to come and see you most of the time and all this. Why would you want to die in a hospital like that? I would rather go fishing. If I got 6 weeks, I got 6 weeks. I'm not going to kill myself to get 12 weeks. What the heck? But that's really what it comes down to, even during the actual successful ones. And success, again, it's measured in weeks and months. It's not years and decades. So other than that, most cancers, most new drugs, not just in cancer, are not measured against a placebo. Most new, like antidepressant drug, it's not measured against a placebo. It's measured against the last most effective drug. This became standard at some point in time where they don't measure against placebo anymore, because in most cases you'll get a 40% improvement on placebo alone. That 40% will beat most drugs. So when they're measuring a new antidepressant, they measure it against an old antidepressant. They don't measure it against placebo. They don't measure chemotherapy against placebo, which wouldn't be smart anyways, because even us in the alternative, we're not saying do nothing, right? A placebo is do nothing. It should be measured, if it was going to be measured, which would be much more complicated. Measure your chemotherapy against a multifaceted alternative protocol, which would be, yeah, which isn't one thing, and it's not very well controlled, right? You want to control each variable. Well, when it comes to cancer, we don't want to do that as holistic people. We don't want to do that. It's not. I'm just going to say take 50 milligrams of vitamin C and have a nice day, you know, and we're going to customize it as much as possible. So it's not a blanket thing. We're going to do as many different things as we can, and that's not going to work out well in terms of a very controlled study. You know, you want to take away the variables in a controlled study. We want to we want to add variables. We want to add more and more things. Cancer is serious. So measuring, this has been one of the main criticisms actually against placebo in cancer, by the way. You better go to a doctor because chemotherapy is more effective than a placebo in some cases. It is. We're not telling you to do a placebo, right? We're not telling you to go home and don't worry about it. Absolutely change the way you eat. Maybe change your environment if you're in a very poisonous environment. If you work in a coal mine, quit your job. These types of things, right? And take lots of vitamins and minerals, not just according to a list, but according to somebody who knows what they're doing, helping you get a program that makes sense for you. And this is a case where ideally, I don't mean to make it too complicated for the listeners and stuff, but just to get like an idea of what a good alternative practitioner would do. They'd run a bunch of different tests. They'd run blood tests. They'd be looking at your hair. You're looking at your stool, all kinds of things to try and figure out what might be missing, what might be in excess, what might be toxic. Most of these cancer specialists in the alternative world will be pulling your teeth out, pulling your fillings out, pulling your root canals out on top of a supplement program, on top of a diet program, on top of hyperbaric oxygen or red light therapy or whatever other stuff saunas. There's a huge list of things that could be applied to you, and they will be making their judgment based on as much data as they can get from you. Again, hair analysis, blood analysis, stool analysis, all kinds of things, looking for parasites, they're not doing one thing. It's so comparing a chemotherapy to a placebo is silly to me, but either way, you won't find very much that does actually compare to a placebo. And in some cases, the placebo does pretty well. And it looks like in most of those cases, by the time you get diagnosed and by the time you get into a trial, you're almost dead anyways. Don't mean to be too negative, but that's what it looks like. A lot of these things, it's like the average patient died 28 weeks later, 31 weeks later. Like, it's not a long time here. So you're already at the end of the line. And at that point in the alternative world, we would do everything we possibly could to support your body and not give you a placebo and not give you poison.
And how on earth would we attribute the contribution of belief to success or failure of either program, either modality that the person took?
Well, I previously would have put a lot of emphasis on it because the placebo effect is real and we do want it. We want to encourage the placebo response. The more you believe it, the better in general to me. If you don't believe it's going to work, it's called the nocebo effect. It might not work, right? And this goes for your therapy as well. Some people truly believe in the chemotherapy, and that belief probably will help them get through it. And, of course, it's been shown that people who have a dog or cat at home are more likely to make it out of hospital and stuff. Like your belief is going to go a long way towards whether you heal or not. But I did also just finish an excellent book here somewhere. I haven't reviewed it yet, but it was all about the plague of positive thinking, basically. And it refuted. It showed some studies. I haven't gone through all the way and nitpick them apart and stuff, but it did a pretty good job of refuting this cult of positivity. And I still think belief is important. We don't need to go deep into that because it's not my specialty, and I was just kind of recently exposed to that counter argument there. So we can maybe talk about that on a later time. But this kind of goes into what we were talking about with the book reviews. Like, you need negative book reviews. And this author, she had breast cancer herself, and she was kind of disgusted with this positivity. You got to be positive. Everything's positive. Everything's positive. All the blogs, everyone's telling you got to be positive. And there really isn't that strong of proof. And there's some studies that disprove or attempt to disprove it, that having a positive attitude is not going to make you live longer. I'm just saying, I got to throw the counter argument out there to be fair. I do believe belief is important, but the evidence is not that strong. Even if there are some miracles in the databases for placebo working, and the people with dogs at home living longer and stuff like that, that is great. I do think your attitude matters, but the evidence is pretty sparse and pretty inconsistent. So attitude is definitely not the only factor here. But yeah, she was saying too, like, look, this is a miserable experience. why do I have to be positive when I'm losing my hair and I'm getting poisoned and I'm inconvenienced and my career is getting messed up and my marriage is getting messed up and this is costing me a fortune, and even if I live, I'm going to be bankrupt. Like, it's not all good. It's not all positive. So that cult of positivity, it can be too much. It can be too much. Your attitude is not enough. It isn't enough.
Yeah, the perspective on that, I guess you could go both ways too, is like either life is happening for you or life is happening to you. And then there's all kinds of people that would suggest there's a way to twist that so that you'll see those things differently. But yeah, if you're approached with the decision to go with this chemotherapy versus to go with a holistic approach, would that in itself, like, I mean, how does somebody navigate that decision-making process? I mean, right now, the reason I'm interested in it is because my cousin is going through an intense chemotherapy regimen, and obviously his prognosis were devastating. They do not give him much hope, but he's going through all this anyways. And I'm talking to my mom about what it would take for her to even offer these alternatives, these other things that have worked for people in the past that go against the same advice that doctors are giving. And how do you offer somebody hope or offer them those alternatives fairly? You know what I mean? Without taking that approach that you need to believe that this can work. And do you try and convince somebody to go against, whatever one that they're entertaining initially themselves without your involvement? It's really interesting little predicament, I would call it.
Well, we give information out and we hope it lands. Mm-hmm. And all the time people come to us and they say, hey, my brother, my cousin, my aunt, my mother is going through this thing. Can you tell me what to do? And my answer is always the same. It's like, yes, we will give you a protocol. We'll give you the questionnaire. You can fill it out for them. But I promise you they're extremely unlikely to actually take the advice unless they see some of our information first. And I mean, you trust us because you saw the information. Would you take some random advice, especially from your son? Like, I mean, they changed your diapers. Why should they believe you? Who are you? Right? This doctor in a white coat is telling me what to do. Who are you to tell me? So unless they see some kind of information, they're not going to do it. Just flat out. Most of the time, vast majority of the time, it starts with information. That's how we start. We put the information out there. People resonate with us. They message us. We don't message people. We don't reach out to people at all. We're 100% based on what people who come to us. So if they don't see the information, it's just not going to happen. So we don't present anything to them really because they've already seen the information and they kind of we can give an explanation, but I don't pressure anybody. You're not allowed to. You can get in big trouble for that anyways. I can't tell you what to do about a drug or a surgery or medical procedure. This is 100% on you. I can give you my opinion and I can tell you what we would do instead. Or if you choose, most people do the chemotherapy anyways. We say, well, if you want to do that and our thing at the same time, this is what I would do. It's the same basic advice. I just don't think it's going to work very well if you have chemo involved, but that is what it is. But let me tell you, this was even a problem in regular medical circles. Believe it or not, there was a time where doctors almost unanimously agreed not to tell their patients if they had cancer because they want to give them hope. They want to preserve their hope. And also with prognosis and stuff, like they don't really, they still want to give you hope. They can't legally and ethically tell you that you'll definitely live. Nobody can make those claims, whether it's a vitamin or a chemotherapy, but they don't want to take hope away from you in general. This is mainstream and alternative. So yeah, hope is good, but hope is not enough. And I think that was a big part of the book as well. Forgive me, I can't remember the name of it right now. We had a 9-day power outage. I read a bunch of books during that time. So internet outage, not power outage, but I mean, look at it too. Instagram. I do Instagram. Okay. I mean, there's this whole cult of positivity. I got really turned off of the personal development world a long time ago, where that phrase you said earlier, it either happens to you or it happens because of you. That can be real insidious because you can legitimately try your hardest and still fail. You can be super passionate, super knowledgeable, super committed, put the time and effort in and still fail. And it's not always your fault. With Instagram, we post almost every day. We're committed. The quality of the posts are better. My performance on it is better. But I can't blame myself when views on the story plummet off a cliff and other accounts are complaining of it as well. What happened? Not me. I got better. And I'm not just being delusional. Like, no, I got better. The quality got better. The posts got better. The followers got bigger. And yet the views went down on the story. And it happened to basically everyone. That's an Instagram thing. It didn't happen because of me. It didn't. It didn't happen despite of me. It happened because of Instagram. I'm just saying there are circumstances that are beyond our control. And when it comes to health, there's a lot to understand. And your success in business or your success in health is not dependent on your attitude. Attitude may be a part of it, absolutely, but you might have a bitter attitude and be more successful. Honestly, you think I'm excited about sitting down on my weekends and making Instagram reels? It's horrible. It's boring. I've got a beautiful wife that I hardly ever see. Do I want to spend my weekends making reels? No. I'm not happy about doing it. I'm not excited. I'm not smiling. I'm bitter about doing it. And yet that is one of the important parts of the business. And again, passion too. You can be as passionate as you want. I've got a guy in my town who opened an art store because he's passionate and he loves art, but he had a terrible business plan and he went out of business. He's super passionate. It's not good enough. Attitude's not good enough. It may be part of the picture, but it's not necessary. Not necessarily even part of the picture of success or with health. There are people with a bad attitude who can be healthy and live a long time. I used to get this because I wrote this in Fake Diseases as well. And I'm going to update this little section here because attitude is not as important as I thought it was, even though the placebo effect is extremely impressive, especially in some cases. And the whole faith healing world, believe it or not, it has some amazing stuff in it. That's fantastic. But as soon as I started putting that information out there, I had people telling me, hey, I had this 98-year-old grandma and she's super bitter. She's not nice. She's not joyful. She's a recluse. And yet she's 98 years old and her blood pressure is fine and all this stuff. Like there's a lot of these people out there, it turns out, that are not joyful, not happy, not they don't have a good attitude. And I don't know exactly how that how that factors in. Other than that, there are other factors that matter a lot more.
So going back to cancer, I'm sure it's come across like more than once the idea that a lot of cancers are parasitic infections, and your belief on that, is that a possibility?
Well, go back to terrain theory. Those who don't know about terrain theory, it's based on the idea that your overall health, your terrain inside of you, is what is going to allow certain parasites to proliferate or not. Try to explain this as succinctly yet as broadly as I can. On that episode you mentioned earlier with the undercover virologist, he brought up a point where it is the extreme of terrain theory. The extreme version of terrain theory believes that all parasites, not worms, but all the bacteria and fungus and mold, mycotoxins and stuff, protozoa, they're all one same primordial organism that changes form based on the terrain. That is the extreme level of terrain theory. The theory itself is that there's this primordial parasite that's not really a parasite. It changes form depending on the terrain. And this is also part of the extreme version of terrain theory, that these parasites are not actually parasites. They're eating debris, eating dead cells and stuff like that. Like, they're not actually the problem itself. And the problem itself will be caused by something else, some toxicity, some pollution, some deficiency, something. And we're putting the blame on these organisms when it's not. I'm not saying I actually believe this extreme version of terrain theory. I'm just saying that is the end of that pendulum. So in cancer, you're obviously sick. And by the way, some of these terrain theory people too even believe that worms are there in a good way, eating bad stuff from us and stuff. I'm not all the way on that side of the spectrum, but if you take that perspective at cancer, somebody is obviously sick. You will find parasites associated with that. Heart disease as well, syphilis and other I think it was Streptococcus. I mean, there's a few different bacterium that have been associated with heart disease for a long time, and it may be true that there are those organisms there in these diseases, but did they cause the disease is the question that terrain theory poses. And I don't personally think so. The average person, I've done a lot of hair analysis, and the average person has parasites. It's true. What we would call parasites. Bacteria, mold, fungus, yeast, worms, they have something in them. But the average person is also sick. The average person's eating processed foods. The average person is chronically dehydrated, living on caffeine and sugar, and has multiple nutrient deficiencies and has obvious symptoms: blood pressure, blood sugar, blood cholesterol, bad skin, overweight, underweight, whatever, you name it. The average person has lots of these problems. So there's no surprise to me that the average person has bacteria, in the perspective that they have created the perfect acidic internal environment that allows these bacteria to thrive, or mold or fungus or yeast to thrive. So it's not that the yeast caused the problem, it's that the yeast is the result of the problem. For most people, I do believe that. We are exposed to parasites. Will it cause cancer? Well, look at some of the populations that have very, very low cancer rates, like Bolivia and Ecuador and China, rural China, very low cancer rates, very low heart disease rates. And yet these people, especially some specific populations that have been studied, shows that they have tons of worms in them. The Hunza people, still regarded as one of the healthiest, if not the healthiest population in the world, in the Karakoram Mountains in northern Pakistan. They have a worm problem. They have worms. And yet they're living long, healthy, happy lives. So I don't blame parasites for very much of the problem. Some people take this way too far. Like the opposite side of the pendulum of terrain theory is people who believe that parasites and bacteria are like the cause of many diseases. There's tons of people out there promoting parasite detoxes and stuff, cleanses. It's a word that was invented just for this. Yeah, weird. I get asked this every single day. What parasite cleanse do you recommend? And my answer is, do you even know that you have parasites in the first place? Fill out this questionnaire. Like, what's going on in your body? Because I said I did hair analysis earlier. When you take the average person, they will have parasites in them if you test for it. Some way, somehow, you'll find parasites. Look hard enough, you'll find parasites. Give them a protocol that has nothing to do with anti-parasite. Give them a protocol. Give them vitamins and minerals. Get them off the bad foods. Give them some basic advice that'll help them. I bet they come back in 2, 3, 6 months and they don't have parasites on the hair skin anymore. Right? This does happen. This is what I expect to happen. I expect all of us to pick up, in quotes there, pick up parasites at some point, because the world is full of parasites. There's fungus. They found it like 10,000 feet in the atmosphere. You know, you can't go anywhere in this world and not find fungus or mold or bacteria. We're covered in bacteria. We're full of bacteria, literally on the inside and outside. So if anything, we're a vehicle for bacteria. Like there's E. coli inside of us. You know, there's tuberculosis inside of us, Epstein-Barr and Candida, and all this stuff is inside of us all the time. And yet it's kept in check when we have a healthy environment. So I don't blame them as being a huge part, but you have read Fake Diseases. So, you know, I'm in the middle of this because I have also been struck by some pretty serious, fast, what I believe are parasitic problems. And at least the one was solved by antibiotics very, very quickly. And I do believe it saved my life. Was that a terrain theory problem? I don't know, because I wasn't healthy at that time. But, you know, it definitely came from a flea. There was zero question about that. It came from a flea. It happened overnight. And in less than 24 hours, I woke up feeling like I'm going to die. I'm bleeding from every orifice in my body. I'm crawling up the stairs and I can barely speak. There was something struck me. I caught something in that sense. I do believe there are some things out there that we can catch. If we are healthier, we should be more robust against them. There are some cases like that one I just mentioned, where an anti-parasitic or antimicrobial compound is what to do. And some of those are natural as well. There's a whole list of natural antimicrobial, antibacterial things, and there's pharmaceutical ones which are appropriate in some cases. I do think you should kill worms if you have worms in you, But my point with the cleanses thing is like, do you even know that you have parasites? Do you have blood tests, hair tests, stool tests? Do you have symptoms? A lot of people don't have any symptoms at all, and yet they're interested in doing a parasite cleanse. And to me, that's foolish. Find out if you have them. Find out if you have any reason to do this. If you have symptoms and you think they're caused by parasite, try addressing a normally healthy life in general and see if they go away, because they usually will. And I mean the symptoms and the parasites. Both of them will usually go away.
So I train jujitsu, and in the jujitsu community, it happens upon all the time that people have staph infections. And I guess it's been a couple of years now, but I got had my first skin infection, and I'm of the opinion that antibiotics should be avoided at all costs, or avoided until you can't avoid it. And I skipped it for a couple of weeks, and I had 2 spots on my leg that just got worse and worse, and then wouldn't heal. And I tried everything you could imagine: the tea tree oils, the honey. I spent a ton of money holistically, and then went to finally the urgent care actually, and they were like, "Why didn't you come in earlier?" And they gave me a couple scripts, took the antibiotics. They called me 2 days later after they tested what it was, and they said, "Oh, we gave you the wrong antibiotics. Here's 2 other antibiotics." Took those 2 scripts, and it knocked out the skin infection. But my gut was destroyed for 8 months, 9 months, however long. So I was in that one experience going, all right, next time, if this were to happen again, I have to, hold out a little bit longer. And sure enough, a year later, almost to the day, I got a skin infection again, and it was very similar. And I used a black salve this time and just upped my vitamin C a lot more, and did all the same holistic measures that I could think of. And it did go away on its own. So I was sitting there wondering if I had waited on the previous, if it would have been fine. But the antibiotics knocked it out so quick that it was just really perplexing with what my beliefs on it were. You know what I mean? Like, I broke down, I took the antibiotics, and it actually did what I needed it to do in that moment. Am I wrong? Have I miscalculated here? It's very perplexing and very, it was aggravating. It was confusing. What is your position on antibiotics in general? Like, I know, that one circumstance for yourself, it paid dividends, but we're obviously over prescribing them, and most people that are taking them don't need them for minor ailments. So where do we draw the line? What do we look to?
Well, this is why there still will be a place for medical doctors to specialize in this. But there are some equally, if not more effective, natural things, and I'm sure the first time you did it, like you said, on the second time you tried something else, or you added something else, you learned something else. You're probably healthier to begin with overall as well. And I hate to put a cop out there, but I have to. It's not our excuse me. It's not our specialty to deal with infections at all. But I can give my opinion on it. And what you described with the staph infection is very similar to what happens with ear infections, or what happens with pink eye, which are 2 very, very common reasons that people go and get antibiotics for. Well, we know that most ear infections will go away on their own in like 3 days, and most pink eye will go away on its own in like a week if you do nothing. If you get healthier, we have no double-blind data or anything to say this, but if you get healthier, we believe it's less likely to happen in the first place. And there's a little bit of decent science about that, but you're never going to find really rigorous controls on this, I bet. So we know that if you do nothing, most ear infections and eye infections will just go away. And this is true even with bigger things. I don't believe in viruses. I don't think you do either, but things like HPV, even the mainstream says that 90% of people are not going to have any symptoms within 2 years. So what does that mean? It means doing nothing is pretty effective in a lot of cases. If it is extremely serious, you could try the antibiotics. You will need to rebuild your guts afterwards. And you could try natural antibiotics too. They're not exactly called that, but there's this huge list of compounds: olive leaf extract and oil of oregano and colloidal silver and garlic, one of the most powerful out there. But if you're putting antibiotic substances into a body that's already unhealthy, it's going to get infected again, basically at one point. The bacteria or mold or fungus. I think this stands true for terrain theory and not for terrain theory as well, that it will proliferate again. If you don't change the environment, it will proliferate again. In your case, we would have to go through the whole questionnaire and see what are you actually missing. Are you taking enough calcium and stuff to actually have a proper blood pH and all this stuff, right?
Calcium was one of those things that did come up at the time, really heavily leaning.
See, there's no way I'm going to remember each person
I
here,
know.
but okay, so that's good. And yeah, that's worth saying too, that a lot of people are eating a lot of carnivore, and even the average person is eating the American diet, which is very high in phosphorus, basically. Not going to explain the chemistry, but that means that you need more calcium. And calcium is the primary alkalizer. So you can eat all the alkaline food you want, which meat is not, but carnivore is not alkaline diet. But you could eat an alkaline diet if you want and still not be alkaline if you don't have enough calcium. And if you're not alkaline, then you will be subject to infections. So the ear infection, the eye infection, the staph infection, I do personally believe, and I think our community of people who do this are pretty good proof where we don't get infections very often or at all. I used to have a bad ringworm problem, fungus problem myself before I got started in this. It got so bad eventually I was ready to cut my fingers off, honestly. It was on my fingers, it was on my toes. It was so bad, so painful, so uncomfortable. And nothing I put on top of it worked, and antibiotics didn't work either. But changing my environment, changing my internal, getting on the supplements, changing my pH, getting off of processed foods, it went away. Took a while, but it went away. And it was a big problem. Honestly, there was a while where I would keep my hand dunked in seawater like all day because it was the only thing that would keep it at bay. It's crazy. That situation I described in Fake Diseases, where I woke up from a flea bite, and, well, a bunch of fleas, I had fleas all over me, and I was incredibly sick, felt like I was going to die. Would that have happened to me in the state that I'm in now? I don't think so. I just don't think so.
Just had invention, histamine reaction, but you'd have fought it off.
I don't think it was a histamine reaction. I genuinely do think it was a parasite transmitted. And I mean, I was literally like the toilet's full of blood. My nose is bleeding. My ears are bleeding. Like my eyes are bloodshot red. Like I'm literally bleeding from every orifice. And it was very, very scary. I felt drunk. I was so disoriented. I could hardly speak. I could hardly make it up the stairs. To me, that's not a histamine reaction. That's a parasite. It was an extreme infection. But would it have gotten hold of me if I was alkaline? I just don't think so. And I don't have any data to prove that or anything. But in that time, I've been bitten by a lot of fleas and ticks and bugs. And spent a lot of time in the forest. And just before I came down here to Texas, so we got covered in sandflies. Oh, man, they're bad. Covered in sandflies, bites all over me. When you first go out into the bush in the spring and you get all these new bug bites, you can feel your immune system reacting to it. You feel a little bit kind of sick. You get a ton of bug bites all at once. I do believe that is the body reacting to the saliva and all that stuff, and possibly the parasites that are in those bugs. And I just never got sick other than that one time. And I wasn't healthy at that one time, and there's nothing to compare it to. And, some people get, quote, infected with Lyme disease and other stuff like that, which might have been what it was, by the way. It might something similar to that. But lots of people get, quote, infected with those things and have no symptoms. So it's very, very difficult to say. It hasn't been figured out. But I do think that, I'm more than 50% on the terrain theory side here, that working on a terrain should prevent those types of things from happening for the most part. And if you do antibiotics, either way, whether it's natural or not, this world is full of antibiotics. God blessed us with tons of antibiotics that we can use on every continent and every climate. There's different antibiotic things that grow there that you could use. Some of them are more powerful than others. Either way, it's going to damage your body in some way, like a drug. Even if it's high doses of garlic, it causes a poison type of effect that you will have to rebuild in some way or reconstitute yourself in some way to make up for that.
Well, I'm certainly glad I went ahead and took it at that time. it was wracking my mind so much so that I wake up and see the same exact size, the same exact look, no healing, to just if nothing else, the psychological relief was worth it, in my opinion. But yeah, it was a tough decision to make at that time, and definitely the second time that I had to decide, I was a little bit more sticking to my guns on it because I was going through this same conversation that we're having right now with my mom, with my parents, saying, if my gut health was better, then this fingernail scratch wouldn't have turned into this boil or this whatever. And that's what my opinion was at the time as well. So to fight it off the second time, to beat it the second time, I was kind of even more steadfast in that belief, and probably steer clear of the doctor's antibiotics even more so. With that said, my dad, he's had health issues for 30 years, and he's the typical, he's on statins. The doctor, he's got heart disease, and he's had several prescriptions stacked upon each other. It all started with chronic pancreatitis, and I think it was gallbladder, then something else, but 8 years into it, after several medications had been added to his regimen, then one doctor finally paid attention to his sleep, and like he had severe sleep apnea, and just that whole, I guess whatever you want to call it, that experience turned me on to the possibility that, man, we are misdiagnosing and prescribing over and over and over for things that could be as simple as you're not getting any recovery, you're not healing. And I think a lot of people are probably in that predicament, and in a situation where if they were open to the possibility that terrain theory was the truth, or that it was real, that they would take different approaches across the board.
Well, yeah. And by the way, for the record, if I ever wake up again from a flea bite that I know is a flea bite, and I know I was fine last night, and I wake up and I'm bleeding out of every orifice, I'm still going to the doctor. No, even knowing what I know now, I'm going to do the antibiotics, and I'm going to rebuild myself after. Not all that is natural is good, and not all that is unnatural is bad. There is a place for some of these things in some cases, and if you're dying from an infection, then you want to deal with it. But if you have a fungus, you have an athlete's foot, you have a staph infection, I mean, it's not life-threatening. It's not the same type of emergency, right. And you can very likely conquer that with natural methods. So yeah, the terrain theory thing, absolutely, this is the direction that the holistic world has gone in. It has to be the direction that the medical world goes in, or people will simply not go to the medical world for most things. That is already happening. If they don't take into account sleep, eating, food, stress. I mean, sleep is ridiculously important. I just did a huge podcast on it. It's crazy important. I spoke for 3.5 hours on that, so I'm not sure we could deep dive in that. But
was that yours? Were you interviewing somebody, or were you just going into it personally?
Just me. Deep dive.
Awesome.
Crazy important.
Circadian rhythms and the importance of consistent sleep, or what do you accomplish during a single night's sleep, what your body does during sleep, everything.
Well, it was titled about melatonin, and I was based on a book about melatonin. Okay. So we produce melatonin to sleep in part, to regulate our circadian rhythm in part, but it's a powerful antioxidant as well. And yeah, we've messed this up. And so, I mean, this is just as long as you don't look at things in a holistic perspective, whether you know the word terrain theory or not, when you don't do all these things correctly, it's impossible to be healthy, at least not for long term. The human body is an absolute miracle. We are blessed with the ability to live on Doritos and beer for like 20, 30 years before something starts to go noticeably or significantly wrong. But at the same time, the average person has no idea what it's like to thrive. And, they might be fine with that, but something will fail. We all know somebody in high school or whatever. I mean, I had buddies all through our 20s that could eat like garbage and drink and do drugs, and they still had a 6-pack and they still looked fine. Well, now we're in our 30s and 40s, and they don't look fine anymore. They have obvious health problems. It catches up with us. So even though we are a miracle and we smoke pretty much every animal on health and longevity, maybe partially to do because of melatonin, by the way, I'll circle back to that. But even though we have that ability to overcome a lot of the stuff that's in our environment, we still need to take all this stuff into account, or we will get a disease and we could possibly die young as well. that melatonin point, one of the most interesting points I found in that whole book was that human beings are the only species, I believe the only species, that we are allowed to fully relax. We have melatonin receptors in a certain part of our brain that allow us to sleep and be completely asleep. Whereas every other animal, whether it's a dolphin or a dog, we all know you can just startle your dog, boom, it's up. In a split second, it's up. Let's go. What's up? The house is on fire. Your dog is up. You're not up. You're like, oh, what's going on here? It's smoke full in the house. You don't know what's going on. It's because you are fully asleep. And I think that's one of the reasons we're able to live so long, is because we can fully relax when we're sleeping. But we mess this up. We now watch screens until past dark and mess our melatonin up. And so we aren't getting proper sleeps. We are relying on depressants to sleep. A lot of people, depressants to sleep and stimulants to wake up. And then we're living on stimulants our whole lives, basically caffeine, right? Coffee, sodas, energy drinks, chocolate, all kinds of stuff to keep us going, because we don't have enough proper energy. Therefore, we're not sleeping properly. We're not restoring properly. On top of that, you add bad foods and nutrient deficiencies, and the fact that the average American person is using at least one pharmaceutical drug or over-the-counter drug regularly, at least, if not every day, if not multiple of them. I mean, this is just an absolute recipe for disaster. We didn't really talk about EMF at all, but that's another problem you add into all that. And as long as the medical world ignores this picture that there is multiple factors to basically every single problem, then they're just not going to get anywhere. And people are going to lose faith in them because they're not going to get results. And that is what has happened. I know I've said that a couple times, but this is where we're at right now, that there's enough information out there and enough momentum in the alternative world where people are realizing this en masse and are walking away from mainstream medicine. And if mainstream medicine has any hope of regaining faith, they're going to have to take this stuff into account. But I mentioned earlier, the problem with making money in the holistic business, you basically have to sell a book or sell a course or something, because they're not going to be able to keep hospitals open on this. So what will happen, to my prediction, is that hospitals will decrease in size. They will get smaller. The staffs will become smaller. They will remain as trauma care centers, which can handle injuries and infections. And that should basically be it. And then the rest of the health world will continue to be massage and other physical therapy and occupational therapy and all kinds of things that are good for us in our stressful lives. And then it will be education. Education is the future of the healthcare industry, I believe, because if you teach people how to fish, they will fish, and they won't need you to catch their fish for them, especially their toxic fish.
Well, important that the results from the classroom project, and hopefully we get people out there to understand it, get this message out, whether it be podcast or their own channels, socials, or even in normal conversations that they have with their friends and family and out and about.
It is happening right now. You're witnessing. What is going to happen with the school program is it's going to teach more people who know this, and what is happening currently is going to continue to happen, which is it's seeping into the public consciousness. I know we all have friends and family who don't care at all. It is changing. It is changing. One person at a time is changing. 10 years ago, 15 years ago, the person who was gluten-free was a freak, right? Now it's your buddy. Right now, it's your cousin. Now 4, 5, 6 people who are gluten free, and that's just one example. I mean, it is spreading slowly but surely. Some people won't give up their beliefs until they have a reason to, and your beer drinking, pizza eating buddies may not have a reason to at this point. But when they have a heart attack, unfortunately, it's what it comes down to for a lot of people. When they have a heart attack, when they get diagnosed as diabetes, when their wife threatens to leave them if they don't lose 80 pounds because they're fat and out of shape. And when this stuff happens, they may take action. For now, they don't have to take action, a lot of them, but it catches up with everyone eventually. And for our parents' generation and our grandparents, if they knew this stuff, like everyone says, oh, my parents, they did the chemotherapy, they did this, they did that. If they knew half of what we know today, if they knew half of what was in this conversation today, they may not have started on blood pressure drugs. They may not have done the chemotherapy and all this stuff. So for a lot of them, it was just too late. And once you do something, you got to justify the reason you did it. It's a weird thing. Once you've done something, you have to justify it. It's like, you see everyone's telling you to go. You go to my accountant, go to my barber, go to my, why? What do you know about barbers? Have you tested all the barbers out there? No, you want to justify your own decisions, and so you recommend what you have already done. And it's a weird thing. We learn this in sales mentality too. People are always willing to promote something that they've already done and justify something that they've already done. So if you already did the blood pressure drugs, you're actually more likely to think that it helped you and to recommend it and to not regret your decision and all this stuff. But if you stop people before they ever do these things, then they're very unlikely to do them in the first place. So we have hope here. The next generation of people like you and I and people who are younger than us, we don't want to do what our parents did because we saw what it did. Right, we saw the blood pressure drugs and the statin drugs and all this stuff. We saw it ruin our parents, and they became fat and they became tired. They went in wheelchairs, and it didn't do well for them. It didn't work out for them. We know what the recipe from mainstream medicine turns out to be. It turns out to be a person who's mostly crippled. They might be blind. They might be on 15 different drugs. They might be in a wheelchair. They might be on crutches. I mean, it's not a healthy, vibrant, happy person that comes out of the recipe of mainstream medicine, and we want to avoid that, and we are avoiding that
and trying all kinds of other stuff because of it. I mean, I'm grateful in that regard. I mean, I tried veganism, I did the carnivore thing, and both of those served some purpose. They both had some results. I think it was basically what I was cutting out of my life when I was doing them, so I couldn't attribute everything to either one of them, but to come and find the balance after the fact and after eliminating all the things that I knew and I learned were absolutely toxic was, invaluable.
Absolutely. Well, I think this is a more hopeful place to end than where you wanted to end it before.
Absolutely. I still want, I'm still looking forward to both, or I guess multiple projects that you've got in the works and more book reviews and following up with the title of the last book that we couldn't come up with. But yeah, where else do you want people to come to you first and foremost besides Wallach's Warriors? Where can they find you?
Well, they can find everything that I do on notusbooks.org as my primary website. I back all the book reviews up there as well as an archive of my podcasts there as well. But all the links are there. You can find all the social media links there. You can find my podcasts and everything. And when the school program is fully ready, which it is almost fully ready, I'm giving like my final approvals on the wording of the capture page right now. Like, it's almost done. That will be on my website as well. You should see it. It's a pretty bare bones website. It's hard to get lost. Whatever you're looking for, you will find it there. And whatever platforms in the future that we're on will be on there as well. And whatever books come out will be on there. It's all there. Notusbooks.org.
Awesome. I mean, this has been absolutely a pleasure, and I'm super grateful for everything that you've done on all of your platforms. I'm grateful I found you. You've had an amazing impact on both my health and my own personal education in several areas, not just health. So I'm thankful for you, and can't wait to look and see what you're doing next and dive in.
Well, fantastic. I appreciate you having me. I hope that at least some people who listen got some value out of it, started thinking about something a new way. That's the start of it all.
Yes, sir. Thank you very much for being here, Ryan. It's been a pleasure.
Appreciate you. God bless. Stay healthy, my friends.
Thank you, Ryan.